Good morning. I convene this hearing of the Subcommittee on Oversight and Investigations entitled Challenges Facing America's Businesses Under the Patient Protection and Affordable Care Act. Today we will hear firsthand from business owners about the impact the health care law and its costs and requirements are having on their employees and their families, the people they care about deeply. First, I am pleased to introduce a constituent from my district, Mr. Jeffrey Kelly. Mr. Kelly is the CEO and owner of Hamill Manufacturing Company, a 62-year-old company based in Penn Township, Pennsylvania. Like many small businesses across the country, Hamill is loyal to its employees, and Mr. Kelly recognizes that providing benefits to employees is not only the right thing to do, but attracts better employees and helps to drive success for all. Yet, as Mr. Kelly will testify today, since passage of the health care law, his company's premiums have risen 46%. That's 46%. And as Mr. Kelly and other business owners look forward to full implementation of the Affordable Care Act in a few months, their brokers and insurance agents have warned them to brace for the higher fees and taxes associated with the health care law. Questions remain for families, workers, and employers because there's a huge gap between what they hoped for and what they got. Good intentions do not guarantee good results. Today, I'm sure the witnesses will continue to hear the same promises from supporters of the Affordable Care Act. Mr. Kelly, I don't think you'll find much comfort in the fact that even though your premiums keep going up, supporters of the law today will tell you that if you look at the numbers the right way, premiums are going down. In addition to the rising costs for businesses, the witnesses today will also explain how the law's requirements will directly impact workers. Steve Lazinski operates a cleaning service that he's grown from 1 employee to over 200. Mr. Lazinski's business is run on a tight margin. When he bids on contracts, the cost of his services is often the determining factor. With less than 6 months to go until the Affordable Care Act is implemented, Mr. Lazinski is weighing 3 options for his company. Option 1 is to reduce every employee's hours to less than 30 hours per week. Option 2 is to fire 100 employees. And there's a third option, going out of business. Mr. Lazinski is a real-world example of how the employee mandate is causing havoc for American families. Members on this committee may have their own opinions on whether the passage of the Affordable Care Act was the right decision, but we cannot disagree on the facts. The costs and the requirements of this law are forcing many businesses across the country to make difficult decisions that will impact the strength and growth of their companies, the wages of their workers, their ability to hire new staff, and the witnesses before us today are not outliers. Last week, a Gallup poll revealed that 41% of small businesses have frozen hiring because of the Affordable Care Act. Meanwhile, the same Gallup poll found that 19% of small businesses have reduced their number of workers because of the law, and that is remarkable. Nearly 1/5 of the nation's small businesses have reduced employment because of the Affordable Care Act. Uncertainty over the impact of this law is building mere months from full implementation. The Nonpartisan Government Accountability Office told this committee last week that implementation of the law is behind schedule. Premiums continue to climb, although this hasn't stopped the law's defenders from claiming otherwise. Competition has failed to materialize as well, and not only are we hearing stories about insurers sitting out the exchanges in places like New Hampshire, North Carolina, and California. Last week we learned that one of the nation's largest insurers was simply going to exit California because the individual insurance market altogether. Meanwhile, stories continue to break about cash-strapped local governments cutting hours of workers because they simply cannot afford the health care law. Again, I want to thank our witnesses before us today, and it takes courage to come here and talk about the nuts and bolts of your businesses. We all greatly appreciate you taking the time to do so. With that, I'm going to turn the remaining of my time over to Dr. Burgess.
I thank the Chairman. And I also want to join with thanking the witnesses for being here, taking time away from your families and out of your productive lives to share your stories with us. It is important that you do so. So the President promised, when he signed the Affordable Care Act, that it would add hundreds of thousands of new jobs to the United States economy. But as we get closer and closer, 6 months and 5 days to full implementation, it becomes apparent that job loss, not job creation, is the actual result. Look, business owners, I know, because I was one before coming to Congress, you tend to be goal-directed. The natural inclination of a business owner is to want to expand and grow. But instead of facilitating this growth, the healthcare law incentivizes businesses to decrease their workforce and even provides an outlet for employers to drop employees by providing federal subsidies in the exchange. The Affordable Care Act not only burdens many workers with lower wages, fewer hours, reduced job growth, but it also increases the possibility of business failure. At a time when the country is finally beginning to find relief from the severe recession and high unemployment, it's not the time to discourage economic growth. Let's remove the hurdles that the President has placed on economic growth and job creation and empower our businesses to propel the United States toward full economic recovery. I thank the Chairman for the recognition. I'll yield back the time.
Chairman yields back and now recognize the ranking member of the committee, Ms. DeGette, for her opening statement.
Thank you very much, Mr. Chairman. I really appreciate you holding this hearing. As we've been discussing for a long time, ensuring that the Affordable Care Act is properly implemented is a top priority for me and should be for all of us. I agree with you that there's a great deal of confusion and even fear about what the Affordable Care Act will mean for businesses and their employees. Just like everybody else on this committee, I hear this every week when I go home to Denver from all sizes of businesses. I hope the hearing can help clear up some of the confusion and bring to light some of the very real benefits this law is already providing to businesses and their employees. I also hope that it can help key in for us some of the areas that we need to improve and have further hearings on in this oversight subcommittee. I do just want to mention several key pieces of the Affordable Care Act that are already benefiting small businesses. The Affordable Care Act contains tax credits that can reduce the cost of small businesses' health insurance by 35%. 4 million businesses are eligible for this tax credit, and nearly 400,000 have already taken advantage of it. Beginning next year, the value of the tax credit will rise to 50% of an eligible small business's health insurance costs. I hope we can work together to help educate our small businesses about this important benefit of the health reform law. On Friday of last week, I met with a group of small businesses at one of our small business incubators in Denver, and I asked these small businesses how many of them really wanted to offer insurance to their employees. All of them raised their hands. Every single one of them raised their hands. And then I said to them, did you know that you will be eligible for a tax credit of up to 50% of your costs? And most of them were unaware of that. So I think there's a big education process that we need to undertake to let people know the benefits they can get. Something else that the Affordable Care Act will help with is it contains medical loss ratio provisions to limit overhead and administrative waste by insurance companies. Now, I heard from the chairman, and I hear from small businesses all the time, that premiums increased dramatically the last couple of years. And that is correct. That's exactly why we passed this bill, and that's why we put the medical loss ratio provisions in the bill, because insurance rates have just been going wild the last number of years. So the provisions that we put into effect in the bill have already helped with $1.6 billion in rebates by insurance companies to consumers. And they've also contributed to $5 billion in premium savings over the past 2 years. But in the next few months, nearly 6 million business owners and employees will get over $310 million in rebate checks from their insurance companies. And these medical loss ratio provisions are only going to continue to work to bend the curve of the increase in premiums that our small businesses have been seeing. The Affordable Care Act contains a number of long overdue, common sense reforms that are driving down the cost of health care and pushing waste out of the system. And as these reforms have gone into effect, we've seen a persistent slowdown in the core cost of health care. Medicare cost growth is at historic lows. PricewaterhouseCoopers found that overall healthcare cost growth was at its lowest level in 50 years. So this slowdown, combined with the other provisions of the ACA, will help small businesses begin to afford healthcare coverage. But we all know the biggest changes are going to come in 2014. Small businesses will have the opportunity to purchase health insurance on the state or federal marketplaces. They will benefit from increased competition. There will be more of a choice of health care plans with quality benefits, and businesses are going to be able to compare them side by side. Businesses will also no longer be in danger of facing significant cost increases just because one of their employees becomes ill or has an accident. Of course, there is also a new responsibility for business owners. Many will be required for the first time to provide minimal health insurance for their employees. I can understand why businesses are nervous about this, but while the benefits are great, the burden is not likely to be as high as folks fear. If a business has less than 50 employees, there's no penalty if they do not offer coverage. If there are more than 50 employees, it's likely that the coverage they already have complies with the law. If they don't offer coverage, there's going to be new options to give people coverage. And so I know there's a lot of healthy skepticism. I hear it from my constituents too. I look forward to working with you, Mr. Chairman, and the witnesses here today to help implement this bill so that it works for everybody and gives high-quality health insurance for all Americans. Thank you very much.
The gentleman yields back. Now turn to the Chairman of the Full Committee, Mr. Upton, for 5 minutes.
Well, thank you, Mr. Chairman. One of my top priorities as chairman of this committee has been rigorous oversight of the Affordable Care Act to learn more about how the law is being implemented and how it is impacting Americans and the nation's jobs creators. Last month, the committee released a report based on actual data provided by the nation's leading insurers that chronicled the looming premium rate shock in store for millions. And just last week, the nonpartisan GAO released a report requested by this committee about implementation, and the findings raised additional red flags. The GAO found that despite having over 3 years to prepare, this administration is woefully unprepared for implementation, and the missed deadlines and delays show potential for further challenges ahead of the October 1st enrollment date. Today, we're here to learn more about how the Affordable Care Act is affecting business owners and their employees. It's our job creators who are on the front lines of implementation. They have a very important story to tell, and I'd like to welcome our witnesses and thank them for taking the time to be here for this important discussion. Like many small businesses across the country, the choices facing the business owners who will testify this morning are not easy ones. Because of the cost of the law and its requirements, these businesses will have to make gut-wrenching decisions, whether they can keep the employees that they have, whether they'll have to lay off employees or reduce their hours, and whether or not they can continue offering health insurance altogether. These are not hypothetical issues. These are real questions businesses are facing today. And we'll hear today, for some businesses, the costs of the law may force them to close their doors, reduce their hours. Despite the President's promise that the law would lower costs for business and families, the testimony of these witnesses reveals that the Affordable Care Act is not, in fact, affordable to a number of them and for many of the small business owners across the country. Sadly, job creators, large and small across the country, are facing very difficult, similar decisions. In Michigan, a medical device manufacturer announced that it would lay off 1,000 folks, 1,000 employees from across its global workforce because of the Affordable Care Act. The health care law's threat to job creators and job growth is real, and I worry about similar announcements that will be all too common. Our rigorous oversight will continue as we fast approach the law's full implementation, and I yield the balance of my time to Ms. Blackburn from Tennessee.
I thank the chairman for yielding. I welcome all of our witnesses, and I especially want to welcome a Tennessean, Mr. Hugh Morrow, who is a constituent of Congressman Fleischman's, and he is out of the Chattanooga area and has a wonderful location there. He's president of Ruby Falls, and Ruby Falls is this nation's largest and deepest waterfall that is open to the public. So welcome, Mr. Morrow. We look forward to your perspective on how the Affordable Care Act is going to affect you, your business, seasonal, part-time workers, and how that law's definition of a full-time employee affects you. So welcome to all, and I yield the balance of my time to the gentlelady from North Carolina, Ms. Elmers.
Thank you, Madam Vice Chairman. And at this time, I am introducing my witness, Mr. Lozinski from North Carolina. It is my honor to do so today. Mr. Lozinski and I became friends in discussing many of the issues that he had concerns about with health care being implemented, or as we call it, the Affordable Care Act, Obamacare, the Unaffordable Care Act. And since that time, we've had many discussions, and I've actually witnessed the changes that have occurred in his business and the concerns that he's had. His business was started a number of years ago in 1998 with one employee, now having 240 employees. He is a small business owner. He loves his employees, they are a family, and he has expressed this to me many times. He is very concerned, and again, I thank you for being here today and the bravery that you're showing coming forward to discuss this issue.
Gentlelady yields back the balance for time. Now turn to Mr. Waxman, the ranking member of the full committee, for 5 minutes.
Thank you, Mr. Chairman. My hope is that this can be a productive hearing. We need to educate small businesses about their new benefits and new responsibilities under the law, and make sure that we're on the right track to have the state and the federal marketplaces for small businesses to purchase insurance up and running by October 1. But I'm concerned that today's hearing will be just another exercise in fear-mongering and misinformation, a continuation of the Republican strategy on health care reform for more than 3 years now. After all, we've faced 37 times efforts to repeal the law in part or in its entirety on the House floor. And even one of our Republicans' witnesses today said, I quote, little patience, unquote, for this fruitless effort. Well, Mr. Chairman, I held a series of forums with small businesses in my district. These business owners wanted to know what the law requires, the benefit it offers, and where they can get more information. This is the law, after all. And they needed the basic facts about the law, not the propaganda. It was helpful for them to know that businesses with fewer than 50 employees do not face a penalty if they offer no coverage to their employees. It was helpful for them to know that the Affordable Care Act does not require employers to provide coverage to part-time and seasonal workers. They were gratified to learn that beginning on January 1, 2014, they'll be able to use the marketplaces to choose from a wide variety of health care plans for their employees, and that they'll benefit from new transparency and competition in the marketplaces, that they will not have to worry about their premiums skyrocketing because one of their employees becomes ill or has an accident, and that they may be eligible for tax credits to pay for up to 50% of the cost of coverage. My colleagues who have expressed a great deal of concern about this issue for employers that may have to close their doors should be reminded 95% of employers in this country with 50 employees or more already have health care coverage for those employees. So when we hear about people closing their door, boy, we hear that for anything that government hopes to do, whether it's to protect people in the workplace from hazards or exposure to chemicals that may harm them, or to regulate the businesses in which they act. We hear it all the time, oh, they're going to have to close their doors. Mr. Chairman, we should be joining together to make sure the Affordable Care Act is implemented effectively, not wasting time on dozens of votes to repeal the law. I noticed that one of our witnesses that the Democrats suggested, Mike Bray, for example, is a business owner who knows that quality health coverage is a valuable way to attract quality employees. He has been seen health insurance premiums rise dramatically in the years before reform. He's starting to see new competition amongst insurers, and finally sees an opportunity to get costs under control. Members of Congress have an important job in the months ahead. Our constituents are coming to us looking for help in understanding their new benefits and new responsibilities. We have an obligation to give them the facts about the law and to help them understand their options in a fair and straightforward way. I hope all members of this committee will join with me in that effort. Our goal should be to educate, not scare or mislead. I want to yield a brief period of time to the gentleman from Maryland, Mr. Sarbanes, to introduce him.
Thank the gentleman for yielding. I appreciate the committee giving me the opportunity to join the hearing today. I'm excited to welcome Michael Bray here, who's a constituent of mine from Annapolis, Maryland. Michael, as you can see, members of Congress will walk over hot coals to welcome their constituents here to these hearings. It hasn't been that difficult today because the committee's indulged me, but we're excited to have Michael here. He's the founder and president of Bray Corporation, which he started back in 1992. he acquired Hobbyworks, which is a unique toy store offering models, trains, planes, boats, games, in 1993. And since that time, he has increased Hobbyworks to 5 locations in Maryland and Virginia. The sales have grown 600% to $5 million in 2012. Michael may be familiar to some of you because he's someone who is a strong advocate for small businesses. He's worked with members on both sides of the aisle over time in both the House and Senate on how healthcare issues impact small businesses. And we're very excited to have him here and hear his discussion of why he thinks the Affordable Care Act offers real opportunities for relief to his business. Thank you, Michael, for being with us. I yield back.
Gentleman's time has expired. So now, although all our witnesses have been introduced, I'll do it one more time here. Our first witness is Michael Bray, owns Hobbyworks. A company started in 1992. It's grown to 5 stores in the Virginia and Maryland area. Our second witness, Jeff Kelly, CEO and owner of Hamill Manufacturing Company, the family-owned business, precision machining and fabricating company serving many defense industry-related needs. Our third witness, Steve Lazinski, Vice President of Sparkle and Shine Cleaning, providing construction and entertainment cleaning along with janitorial services. And last witness is Hugh Morrow, President of Ruby Falls, the nation's largest and deepest waterfall open to the public. Because of the seasonal nature of his business, Mr. Morrow has both full-time and part-time employees. I'm now going to swear in the witnesses. You are all aware that the committee is holding an investigative hearing, and when doing so has the practice of taking testimony under oath. Do any of you have any objections to testifying under oath? All the witnesses answered negative. Now, the chair then advised you that under the rules of the House and the rules of the committee, you're entitled to be advised by counsel. Do any of you desire to be advised by counsel during your testimony today? And all of the witnesses say no. So in that case, if you would all please rise, raise your right hand, I'll swear you in. Do you swear the testimony you're about to give is the truth, the whole truth, and nothing but the truth? Thank you. All the witnesses answered that they do. You are now under oath and subject to the penalties set forth in Title 18, Section 1001 of the United States Code. You may now each give a 5-minute summary of your written statement. We'll recognize first Mr. Bray for 5 minutes.
Thank you, Chairman Murphy, Ranking Member DeGette, and members of the committee for having me. As you heard, my name is Mike Bray, owner of Hobbyworks, a hobby and toy shop I acquired in 1992, which I've since expanded to 5 locations in Maryland and Virginia. I also volunteer my time and entrepreneurial expertise to help other small business owners and small business advocacy groups find solutions to problems that we small business owners face every day. One of the fastest growing problems is the nonstop rising cost of health insurance, and that's what I'm here to talk about today. From the very beginning, I offered health insurance coverage to keep and retain my good employees, and one of the first questions people ask me when you're hiring is if you provide health coverage. And I have taken some pride in being able to say yes, and the coverage we're offering you is the same coverage that the president of the company and his family are on. My business has been successful and we've been able to grow, but my ability to keep my workers happy and secure by providing health insurance coverage has eroded. Our health plan once cost $100 a person, all of which was covered by the company. Over the years, our premium has tripled. My employees have seen their costs increase 5-fold as they pay more of the premium for worse coverage. My workers are burdened by high deductibles, and so they put off preventive care for themselves and their children by avoiding the doctor. Passage of the Affordable Care Act was the first thing in years that gave me some hope that this endless spiral of escalating costs and declining quality of coverage might finally end. I'm looking forward to full implementation of the Affordable Care Act next year when our state exchange opens and more cost containment provisions go into effect. Perhaps then I will finally start to have the certainty and stability every business owner craves. There are benefits of the ACA for my small business. Long before anybody ever heard of Obamacare, the high cost of health insurance was one of my top business concerns. Costs skyrocketed for many years while quality of coverage decreased. The status quo was utterly unacceptable. Doing nothing would have wreaked havoc on mine and other small business owners' bottom lines and our ability to create jobs. An MIT economist, Jonathan Gruber, did an analysis of the consequences of doing nothing. He found that without reform, employers would pay $2 trillion in healthcare costs by 2018, costing several 100,000 jobs, $800 billion in small business wages, and $50 billion in profits. Those numbers show why passage of the Affordable Care Act was so important. There have been objections from small business owners about this law, but I believe that that discontent is largely based on misinformation and myths. One myth I hear all the time is that small businesses will go out of business because they'll be required to provide costly health insurance to their employees. This is simply not true. 96% of businesses in this country have fewer than 50 full-time employees, which means they're essentially unaffected. Of the 4% who do have more than 50 employees, 96% of them already offer insurance. So that leaves less than 0.2%, not 2%, 0.2% of small businesses that have more than 50 full-time employees that don't offer insurance that will be impacted. That's a pretty small segment of the community. I'm one of those employers with fewer than 50 full-time equivalent employees, and starting next year, I'll be able to use our state shop exchange to purchase coverage. This is huge. In Maryland, we haven't had a lot of choice. This exchange will allow me to pool together my buying power with other small business owners when purchasing insurance, presumably with a larger, with more competition and a larger pool. The market will become more competitive and prices will stabilize, maybe even come down as a result. And I crave this kind of predictability. Another way the law will help me is to rein in the hidden costs in the system, like shouldering the burden, the huge burden of uninsured receiving medical care. When everybody is required to have insurance, there won't be the need to pass those costs on to me. The Affordable Care Act isn't perfect and won't solve all of our business problems overnight, but it is the first meaningful law in decades that meets many small business core needs in regards to rising healthcare costs. In this fragile economy, policies that allow me to spend less on health premiums and reinvest more of my profits and create more jobs is what I need the most. Implementing and strengthening the Affordable Care Act is the only logical path forward to lowering the overall cost of healthcare, providing more options for coverage for small business owners like myself, and enabling small businesses to resume our traditional role as primary job generators. I'd like to thank the committee for having me and giving me the opportunity to address you today.
Thank you. Mr. Kelly, you're recognized for 5 minutes. Phone's on and pull it close to you, please.
Good morning, Chairman Murphy, members of the committee. Thank you for the opportunity to testify today. My name is Jeff Kelly, CEO and owner of Hamill Manufacturing, a veteran-owned family business based in Penn Township, Pennsylvania. The company was started by my father in a chicken coop in 1952 in our backyard. Our first contract was for parts for the USS Nautilus, the first nuclear-powered Navy ship. Hamill has produced critical components for every naval reactor built since, and we plan to continue to do so. Our company is made up of machinists, welders, inspectors, engineers, administrators, among others. There are about 125 of us in the Hamill family, and I cannot stress that point enough. At Hamill, just like thousands of other small businesses, our employees are our family. I plan to retire in 4 years, at which point Hamill will be 100% ESOP. Currently, the employees own 49% of the company. We pay well. Our average salary is about $50,000, which combined with our company size means we are largely on our own and will not benefit from most of the subsidies and tax credits from the Affordable Care Act. We offer good benefits to help to attract and retain talent. In Southwest Pennsylvania, companies like ours compete against much larger employees who can offer higher wages and more easily absorb increased health care costs. The irony is this: the cost of our generous plans are increasing so rapidly that we can no longer provide regular wage increases, which we need to attract and retain the best talent. Our health care costs for the fiscal year ending March 31st, 2010 were $795,000. Today, with the same number of employees, there are 1.2 million. And when we would have been 1.8 million were it not for changes we made to prevent catastrophic increases difficult for any small business to absorb. The future should be bright, but current and future health care costs cloud it. The Affordable Care Act is proving to be unpredictable and unaffordable. Since the passage of the law in 2010, our health care premiums have increased 46%. They would have been 20% higher if we had not taken some extraordinary means to hold the increase to 20%. A nearly 50% increase in health care costs is virtually impossible for a small business to absorb, let alone a 2/3 increase. To avoid the additional 20%, we changed carriers, doubled our deductible from $2,500 per individual and $5,000 per family to $5,000 and $10,000. We also instituted an aggressive wellness program and charged a premium for all employees and spouses who are tobacco users. The higher deductible was misleading, since we as the employer cover 95% of the employee's cost, meaning the company covers $4,500 or $9,000, while the employee pays a $500 individual and a $1,000 family deductible. That means the amount the company will pay each year actually depends on how many employees and by how much they exceed their nominal deductible. In the past fiscal year, those additional costs were $110,000, money we could have used to hire 2 employees or increase wages to retain employees. So we track 2 numbers, the premiums we pay and the company portion of the plan deductible. Currently, the company pays 80% of the premium while the employee pays 20% of the balance. In time, we will have to ask employees to share more of the expense towards a 60-40 split. The speed with which we move to that position will depend on how steep the future cost curve is. That may in turn cause us to lose valuable employees. Talk about a no-win situation. In addition to the actual cost involved with having a company-sponsored healthcare plan, one cannot overstate how much management time and resources are spent on administering the plan. One wonders if running or starting a small business is really worth the effort. I want to be clear. This is just not about how much our company pays for health care. I know many believe the Affordable Care Act will lower costs for small businesses, but the opposite has occurred for us. As implementation nears, insurance companies are pushing down as many increases as they think employers can absorb. Unlike the federal government, we in small business have to budget for future costs today. How can I develop a business strategy for 2014 when I can't estimate future costs? We will manage next year, but I'm most concerned about when our company becomes 100% employee-owned. I doubt they will like running a healthcare provider, which is what we're becoming, instead of a manufacturing company that they thought they were getting. Thank you for the opportunity to testify before you today and bring attention to this serious problem.
I thank the gentleman. Mr. Lizinski, recognized now for 5 minutes.
Good morning. Thank you for the opportunity to speak
Please
with
make
you
sure your
today.
microphone's on and pull it close to you.
Is it?
Yeah, you got to pull it close. These are very sensitive. Thank you.
Thank you. My wife Kathy and I run a cleaning company in Apex, North Carolina with 240 employees. We are very concerned on how this law will affect our employees. With a $2,000 fine for every employee after 50, we cannot afford the $380,000 a year that the law will cost us. It looks like our only option will be to cut our employees' hours to less than 30 hours a week, but this will have a devastating effect on our employees' paychecks and their ability to pay their bills. Most of our employees are minorities, and we also have programs to hire felons that cannot find work anywhere else. So this law that was supposed to help lower income workers will end up hurting my lower income workers. We try to be fair and follow the law and pay all of our employees over minimum wage, but because some of our competition pay their employees off the books or as 1099 employees, they already start off with a competitive advantage against us because they don't pay unemployment insurance, compensation, Social Security, and Medicaid. So with the implementation of this law, they're not going to follow this law either, so that just gives them another competitive advantage bidding against us. 90% of our jobs are bid, so it's a very, very small margin, and it's a very tight competition. So our competition who don't play fair, this will give them an extra competitive advantage against us. But I'm not here to criticize the law. I'm here to try to find a solution to our specific problems for our employees and to try to better them. So any suggestions you have will be greatly appreciated. Thank you. Sorry, a little nervous.
You're
You're doing a great job. Thank you, Mr. Lizinski. Now, Mr. Morrow, you're recognized for 5 minutes. Make sure your mic's on and pulled close to you.
Okay, thank you. Can you hear me fine? Good morning, and thank you, Mr. Chairman and members of this committee. I'm here today representing the Ruby Falls and its employees. Ruby Falls is an 84-year-old small business that employs over 100 strong in the height of our season, and is supported by approximately 40 full-time employees year-round. Ruby Falls is better known as the tallest underground waterfall open to the public. We have been mentioned in such lists as the top 7 natural wonders in the USA and the number 2 underground waterfall by World Reviewer travel site on Earth. A simple way to explain what we are: you take a 260-foot elevator ride down into the cavern, walk 2,000 feet into a limestone mountain, And when you arrive at the falls, you are 1,100 feet underground and view a 145-foot waterfall. People have been doing this for over 80 years. During 2013, we will host close to 400,000 people. It truly is a unique experience that has spanned generations. Since 2008, Ruby Falls has had its challenges, as most small businesses have in the travel and leisure area. Disposable incomes have been down, the cost of travel and energy prices have been up, so they're being reliant on the drive-in market, we have struggled. Fortunately, Ruby Falls has thrived over the 5 years. Our workforce is comprised of full-time and part-time workers that are second to no organization in this country. I could not be prouder to be representing them today. This group is a homogeneous mix of Ruby Falls career employees, retirees, and those working while transitioning to other jobs, and a mix of students both high school and college age. Our payroll has increased 27% over the past 4 years, and this does not include the contract labor such as technicians, plumbers, and electricians that we retain. Many people ask me, how do we keep such a great group? The main reason is that we fit and conform to where they are in their life situation. One of those options is that we offer full-time qualifying employees health insurance that is 100% employer paid for the individual coverage. How can an employer manage these costs? We have crafted the plan that works for both us and our employees, that focuses on their needs, not the needs of every American. Now, because we have to combine the full-time employees with part-time employees that choose to work for us part-time, our full-time equivalents will exceed 50 employees. Why is this important? Because we are in this category, we will not be able to buy insurance at the benefit levels that work for our business, and will have to move to higher levels that are mandated by the Affordable Care Act. And since 2006, we have seen premium increases that have not exceeded 5%, but this past year we saw 21% and are projected to see higher than 30% increases for 2014. We are working in a very competitive market. As I mentioned earlier, absorbing these costs and passing them on to our customers is not an option. We have spent more time analyzing the effects of this law than creating memories for our visitors. For the first time in my career, business growth and creating jobs has become a secondary task. Why invest capital? Significant cost increases we will see because of the increased mandated benefits will reduce our ability to grow going forward. As I mentioned, we have grown our payroll 27%, invested over $2 million in capital and expansion, and invested in the Chattanooga and surrounding Tennessee community. Ruby Falls was the first U.S. attraction to be certified by Green Globe, an international achievement for our environmental stewardship of our business. A huge part of that certification was a reduction of power usage, and we were the first solar-powered cave in the U.S. Yes, solar power is an important part of our ongoing plan. Throughout these tough economic times, we have operated on less resources, reassigned and eliminated non-productive positions, reduced inventory, but have still managed to increase customer satisfaction and revenues. The expenses created by the Affordable Care Act are not affordable and will force us to reduce payroll, share in the costs, reduce investment in growth, or a combination of all three. None of these solutions create jobs. I represent our team by saying the coverage we have, we would like to keep, but the coverage we are being mandated to have is unaffordable. More people have health care coverage available today because we grew our business. We hope to continue to do that going forward, just as we have in the past, and thank you for your time and attention. I look forward to your questions.
I think the panel, Mr. Moore, we're looking at pictures before of the falls. We'd love to have a hearing there sometime. It'd be nice. Have that. I'll go on with questions, and I'll recognize myself first for 5 minutes. Mr. Kelly, you testified today that since passage of the Affordable Care Law, your premiums have continued to climb. Could you elaborate on the amount of your recent premium increases, and do you expect more in the future? Microphone, please.
As I said, it was a 46%. That's since 2010. There was one big year, which was last year. That was 23. Well, actually, it was 23%. The initial premium request that came in from Highmark was 42%. We were able to. We had to double our deductible, and we had to basically tell them we're going to leave them if they don't we ended up with a 23% increase. That was last year. This year we moved to from Highmark to Health America, and we still had a 15% increase, and that was when we doubled our deductibles again.
Can you give me an idea what the cash amount of that percentage is?
Well, yeah, I can actually.
Well, if you don't have it handy,
I can
you give it
actually
to us.
show you.
I was just wondering
exact
with
number.
regard to
Yeah.
percentage, but I just wonder how much, but that's something that comes out of the employee's
It's a
pay.
couple $100,000 is what it means.
Okay, just wondering what that was per employee. Well, how has it impacted your ability to plan for the future? Are you able
Well,
to hire or expand?
You know, you have to figure out what we're going to do to keep employees. You know, what we're faced with in southwestern Pennsylvania are our competitors are large OEMs. They're not other small businesses. And they typically can offer higher wages and richer health care plans. So when I ask my employees to pay more of the premium plus have a higher deductible, even though we cover 95% of the deductible, it still means less money in their pocket. So I just had a welder walk out the door the other day because under our new health care plan, there was a certain procedure that was covered under Highmark, wasn't covered under Health America. He said his wife needed this procedure. He left. He went to the Elliott Company. And that's happening, and I expect it to happen more regularly.
So you're saying, your conclusion is that this, the way healthcare is going, it's affecting your ability to recruit or train or
Absolutely,
workers?
Congressman. We're very, very careful about hiring somebody today. Where I need welders and I need machinists, but frankly, I've got to be very, very careful because of knowing that when you hire somebody, you're going to pay at least $50,000 in wages, another $20,000 in benefits. You have to be very cognizant of what that's going to mean to your bottom line.
Well, so supporters of this law have claimed that either directly costs have gone down, or with tax credits, it's going to lower your costs, allow you to keep the coverage you currently enjoy. First of all, are you able to take advantage of these tax credits?
No.
Why is that?
Because we're 125 people.
And it
We're too
cuts
big.
off at a lower,
Too
much
big.
lower number.
You know, this gentleman talked about 96% of the small businesses, but the 4% of the small businesses that are well over 50 people. You know, small business think if you have less than 750 people, you're a small business. You know, if you're a manufacturer, I think in some of our federal contracts, if we have less than 500 people, we're a small business. So what's the definition of small business? Maybe under affordable health care, it's 50. But there's a lot of people in that sweet spot. I was the chairman of the NTMA, or the National Tooling and Machining Association, in 2007, and I traveled the country. I talked to colleagues over the country, and many of them are well over 50 people, and every one of them is going to be affected by higher premiums and higher costs. And I can hear right now from my colleagues across the country, they're very careful about hiring people. What we're doing is looking at automation and productivity using machine tools. I'd rather invest in a machine tool than a person right now because I don't have to pay health care for a machine tool.
So robotic things instead of people.
Yeah.
Mr. Lazinski, are you able to take advantage of the tax credits that are being touted here?
No, I mean, even if it pays 50% of my health care cost at, $450,000 a year, I still couldn't afford the 50%.
Well, I think my understanding is the tax credits are only available if you have fewer than, 25 employees? I think you're beyond that.
Yeah, we're at 240.
Mr. Morrow, you're beyond that level too, so the tax credits don't apply?
We will be right at 51 employees.
I see. Mr. Kelly, again, so as someone who operates a business, with the full implementation of the law coming out, let me ask this. Do you believe it's easy to even understand what the expectations are in terms of what this is going to impact in the future?
I don't believe so. I talked to my broker at length, and he's a very close personal friend of mine. In fact, he just sent me an email the other day to tell me that there are 4 fees that are going to go into effect next year, starting January 1st. The patient-centered outcome research fee, the transitional reinsurance fee, the risk adjustment fee, and the insurer's tax. Those fees alone next year, in the 3 months that are involved from January to March, are going to cost me $11,000. In the full year, from April 1st, 2014 to 2015, it's going to cost Hamill an additional $48,000. That's for no more better coverage, no change. These are just additional fees that are coming down the road because of the ACA.
Thank you. I see my time's expired. By the way, thank you for your service in the Marine Corps. Mr. Getz, recognized for 5 minutes.
Thank you very much. I just want to ask a quick little series of questions. to try to kind of clarify where we need to go to help small business be able to afford insurance. Mr. Morrow, you offer insurance to all of your full-time employees right now, correct?
Correct.
And Mr. Kelly, you do also, correct?
That is correct.
And is it Bray? Bray. And you offer insurance to all of your employees, correct?
Correct.
And Mr. Lazinski, I would assume that you would like to offer insurance if you could afford to do it from a cost perspective.
If I can
Is that
afford
right?
to do it, of course.
And I think, Mr. Morrow, the cost of insurance is not cheap, and it's been going up for some number of years. Is that right?
We have not seen substantial increases
you haven't
until
seen
this past year.
Okay. Mr. Kelly, I think you testified that it's been going up quite a bit the last few years.
Yes, it has.
And Mr. Bray, you too? Have you seen insurance increases?
Oh, yeah, for nearly a decade.
I'm wondering if you can, Mr. Bray, talk to us about why you think it's important to give health insurance to your employees.
Well, you know, when you're one of those guys, young men or whatever, working for somebody else in a low-wage job like I did a long time ago, you always say to yourself things like, well, you know what, if I ran the company, I would do blank. And so, you know, working in a frontline retail job, as I did, if you were offered insurance, it was crap insurance.
And it was unusual that people were offered insurance in jobs like that, not just young men, but young women too.
If you were offered it at all. And that's always bothered
Right.
me. So it's something I sought to do differently right from the beginning.
And you have done it from the beginning. And has it hurt your ability to grow as a company?
We've grown 600% over a period of time. We survived through the recession. We added employees.
Okay. And do you think the fact that you offer health insurance helps you attract good employees?
Yeah, absolutely.
Okay. Mr. Kelly, now you testified that your health insurance costs have increased about 50% in the last 3 years. Is that right?
Yes, it's actually, the costs were, the premiums were 46%.
Yeah, they went from 795,000 to 1.2 million, right?
Correct.
And Mr. Bray, I think you testified the health insurance costs for your company have grown the last number of years too. Is that correct?
That's correct.
And do you know if your health insurance has cost about the same as your larger competitors, or has it cost more?
For a small group in Maryland, it costs more because we're not.
I think that's true in Colorado and probably every place
Yeah,
else.
we only had we have from 1 to 3 providers at any given point in time.
And what about shopping for coverage? Was it easy to compare plans side by side, or did you have to hire brokers? What did you do?
I guess in the sense that in Maryland there's so little competition, they all offer identical plans at roughly the same price. It makes it easy to compare pricing, but it doesn't make it easy to find affordable coverage or a variety of coverage.
And this has been going on for quite a while. Is that right?
Yes, that's correct.
Okay. And Mr. Kelly, your costs have been going up for quite a while too. Is that right?
That's correct.
And so what we're trying to figure out here with the Affordable Care Act, we're trying to figure out how to bend that cost curve. And that's part of what we're trying to figure out, but we're also trying to figure out how to make it accessible for folks. And Mr. Lazinski, that's one reason why, I think about employers like you who are employing lower paid workers, but you still want to be able to get them in some kind of insurance. Are your people eligible for Medicaid?
I'm assuming yes, a lot of them are.
And so that would be help. You could get those folks enrolled, and you wouldn't have to pay a penalty. Did you know that under the new bill?
No.
See, part of what I think we need to do is get this word out to employers. There's a lot you can do. It, Mr. Morrow, I was thinking about what you said. You said you've got 40 full-time employees, right?
Approximately.
So technically, you would be under the 50 employee limit under the Affordable Care Act, right?
No.
Except for the part-timers that somebody is telling you that are these part-timers year-round or just seasonal part-timers?
These part-timers are year-round.
Okay, so they're going to be put together in a group, and you believe that's going to take you over 50 employees. So I think that's an area we should look at as well, because you want to offer your people insurance if it's appropriate for them, right?
We currently do, yes.
Yeah, you just don't want to have to go broke doing it. I think that's
Correct.
everybody's goal here. Okay, thank you very much, Mr. Chairman.
Generally, time expired. Now turn to the Vice Chair of the full committee, Dr. Burgess, for 5 minutes.
Thank you, Mr. Chairman. Mr. Morrow, let me just ask you a question. You do have seasonal employees, correct?
Correct.
So if I were to go to one of your typical seasonal employees on January 1st of 2014, the year that this thing is implemented, and I were to ask them to estimate their earnings for the coming year, would they be able to give me an answer?
Well, most of our seasonal employees are in the summer, so January would not be a good time. But in the summer, yes, they should be able to.
But here's the point. On January 1st of 2014, they're going to be asked, as they apply for this Affordable Care Act insurance, they're going to be asked what their earnings are for this year coming up.
Correct.
And many people, myself included, when I ran a medical practice, would have difficulty coming up with that figure. So if they're wrong when they estimate that number, and they underestimate their earnings, they will receive a subsidy to buy health care in the exchange if you don't provide the insurance for them. And then they could be required to pay that back if their actual earnings, as reported to the IRS, so that information will be available to the government, so they could be required to pay that money back. Is your experience that your typical seasonal employee would hold money in an account in case they had to pay it back to the government at the end of the year?
No, sir, they do not do that.
Yeah, I wouldn't think so, because I wouldn't do it either. And we've had other people on other panels, and you deal with that issue of how are you going to estimate your earnings when you're a lawyer in solo practice, when you're a doctor in a group practice. How are you going to estimate your earnings over the coming year when it's entirely contingent upon factors that are completely beyond your control, such as the economy and other things that may be affected. Now, I think we're all getting a clear understanding as the law comes toward completion, or at least the 2014 completion, and I have a copy here if anybody wishes to reference it. But it's pretty difficult to know what the road ahead is, and it's difficult for us to be able to advise you of the road ahead. And I dare say, although it's difficult to get answers out of the agency, have any of you contacted the Department of Health and Human Services or the Office of Personnel Management? If your state doesn't do an exchange, the government's going to do, the federal government's going to do it for you. Have any of you contacted them for information about what the next year looks like? Yeah, and I dare say they wouldn't be able to tell you, so I don't blame you for not making that contact, but that has historically been a difficulty. Now, Mr. Lozinski, and I think Mr. Morrow, you too, you both referenced the fact that you deal with competitive environments. You deal with the fact that there are other people out there competing for the same space and the same entertainment dollar in Mr. Morrow's case and the same cleaning dollar in Mr. Lozinski's case. Tell me, and both of your businesses have over 50 employees, is that correct? Mr. Lozinski, are you over 50?
Yes, oh, yes.
And Mr. Morrow, you're over 50?
Yes.
So what is the fine that people talk about that you might face? Do you have a clear understanding of what that fine is? Say you have an employee, you're providing insurance, but they go and say, I want the subsidy in the exchange. I don't want your insurance, Mr. Morrow, I want the subsidy. Do either of you feel free to answer, do you have an idea of what that fine is and why it's there?
I don't. I just know that if you can't afford to pay for insurance for your employees, the government's going to fine you, I think it's $2,000 the first year and then $3,000 the second year.
And I appreciate you may not know the specifics. I dare say people on this panel don't know the specifics. But are you aware, as confusing as this law is, we're not done with you yet. The Senate is working today, this very day, on S-744, a major immigration overhaul for this country. As a consequence of that law, there will be a group of individuals who are called registered provisional immigrants who will not have the Affordable Care Act available to them. The President told us this 2 or 3 years ago when he came to Congress. So they'll be outside. So, Mr. Lozinski, can you imagine a competitor who would staff their roles with people who are RPIs and therefore outside the requirement of the Affordable Care Act? Can you imagine having to compete with that as a business?
No, yeah, that's part of the problem because most of our competition, like I says, are either below 50 employees, or they pay their employees off the books, or they make them 1099 employees. So.
And yet you offer employment to a group of individuals. We got 22 million people unemployed in this country. And you offer employment to some of the hardest people to employ. Is that correct?
That is correct.
So how does it make you feel that your government is going to set up your competition to make your business model essentially extinct?
Well, I mean, I'm very concerned about it.
Of course you are, and I understand. I appreciate you all being here. I share your concern too, sir. Thank you.
Now I recognize the gentleman from Texas, Mr. Green, for 5 minutes.
Thank you, Mr. Chairman. And like a lot of us, these hearings, and I know there's issues with this law, and there's issues with any law that Congress passes. And a lot of us on our side of the aisle has tried to sit down and say, okay, what can we do to make it better for the witnesses who are here today? And that's our issue. Instead of talking about how bad it is, the law is going to be the law. The Supreme Court upheld it. We passed 33 times last Congress in the House, and 1 time this Congress. It's not going to change. So maybe we ought to quit saying how bad it is and say, okay, let's get a list of things to fix it. And we're not seeing that in this House of Representatives. All we're seeing is let's paint it bad. Well, I have information that says, for example, in California, they're going to set up their own state exchange. The premiums are going down, and also they've announced that there's going to be at least 5 different insurance carriers. In an earlier life, I managed a small business with 13 employees. Part of our employees were a union bargaining unit. We had the option to go into the union plan or have a plan that met that for all our employees, including our front office. And my job was to negotiate benefits with those carriers. And like some of you, I couldn't get anyone to negotiate. We couldn't get the top tier companies particularly. So we would battle every year. And we were seeing the same percentage increases as you have seen in your time. But we're also seeing that some of those percentage increases are going down. And maybe we ought to hear from that. I'd like to hear from Secretary Sebelius and some of the members of who are the information that we've gotten come to that. So, I'm glad y'all are here, but we really need to find out what can we do to fix it, because the law is not going to go away, and we have to deal with it. But in this House of Representatives, we're not dealing with it. All we're doing is saying, the dam's going to break and we're going to get flooded. Well, would it be nice to say, okay, let's deal with it and see how we can come up with some better things. But as we know, on October 1st, the state exchanges or the national exchange. I'm from Texas, and we're not going to have any state participation in our state exchange. So we will have a national exchange. And I'm looking forward to having at least 5 plans, whether they're from the Blue Cross, Aetna, you name it, because when I was in business, we couldn't get 5 companies to give us a price. In fact, my experience was we signed a 3-year contract, but it was always premium reopened the first year. And so I ended up having to negotiate premiums every year on a 3-year plan. And I know that's the experience y'all are having. And because we didn't decide to only cover 5 of our employees under our bargaining unit and then try and find for the other 7 or 8 employees we had. Small businesses have a right to be nervous about health reform, but a lot of us who voted for that made sure there were things in there to help small business. The 50 employees, that's the same thing for minimum wage. That's not, new law. If you're over 50 employees, you have to pay minimum wage. And so now you're going to have to cover your employees with some type of health care. And each of you have particular issues, and I wish Congress would take those issues and say, let's put together legislation to do it. Instead of, as some of my colleagues said, talking about how bad it is, let's see how we can fix it. And when I managed the business, that's what we did. If I lost a customer, I'd say, wait a minute, what did we do wrong that that customer left us? We're not seeing that in this House of Representatives, and that's what's frustrating. I have a district, though, in Texas that's 44% of my constituents who work did not have insurance through their employer. Only 32% did. It's a very urban area. I have some of the biggest companies in the country, refineries, chemical plants, service companies for the oil and gas industry. But again, 44% of my constituents who work didn't have insurance through their employer. So that's why there was a lot of support for this, because those employers were not providing health care, and they were showing up in our emergency rooms, and those of us who had insurance were continuing to see those premiums increase because somebody was paying that bill for those folks showing up in the emergency rooms. Mr. Bray, Is it fair to say that the health insurance market for your small business has been problematic for quite a while?
Yeah, we have anywhere from one provider choice to three provider choices.
There was a reason why Congress passed the Affordable Care Act, because the health insurance market for individuals and small businesses were dysfunctional. I also served in the state legislature where we tried to create plans. But the problem is that if you have a high-risk plan and all you have are people with high risk, nobody can afford it, including employers. And I went through the experience some of you had. Since I negotiated it, our insurance carrier came in and said, this lady had, in your plan, had a double mastectomy. If you separate her and get an individual plan for her, we can save you money. And I explained to him, I said, you know, I'll be glad to share that with the owners because that happened to be the owner's wife. And so, you know, and I'm glad that company did not do that, and they wouldn't do it for the owner's wife, and they'd do it for the other 12 employees that we had. But the Affordable Care Act hopefully will solve some of these problems as of January the 1st, and the shop marketplaces will allow more competition and more transparency. That was the other reason. When I would see those premiums increase every year,
Gentleman's time's
I never
expired.
understood why and why they did. So, but anyway, I appreciate y'all being here, explaining your problem. Now, if we would do our jobs and try and fix some of those problems.
Thank you. Gentleman's time's expired. I appreciate that. Thank you. I now recognize Mr. Olson for 5 minutes.
I thank the chair, and welcome to our witnesses. I go home to Texas 22 every weekend, and I get out and go to small businesses to hear how they're impacted by Obamacare. I've been to property management companies, oil and gas service companies, even Block Talk, an area of Spanish language businesses in historic Rosenberg, Texas. In broken English, in Rosenberg, these three words were said over and over and over, which sums up Obamacare's impact on every family business in Texas. Bad, hurts, stop. There are many job-killing, growth-stunning parts of Obamacare. My question is going to focus on a small part of the law, which is likely the very people the law is supposed to help. Americans working minimum wage and low-skilled jobs. They're being locked into a future of stagnant wages and few opportunities for personal prosperity. I'm talking about that small section which defines a full-time employee as someone who works 30 hours per week. My staff has done some research. There are over 100 regulations with different definitions of a full-time employee. Obamacare is the first to define it so clearly and so broadly, 30 hours per week. A new name has emerged in American business, 29ers. People will only be employed for 29 hours because of Obamacare. And I want to follow up my questions from my colleague from Texas, Mr. Burgess, and this to you, Mr. Lozinski. Sparkle and Shine, your testimony says, has 240 employees, 85% of which are minority employees or people trying to get a new start from being incarcerated.
Correct.
And you write your testimony, you have three options going forward with Obamacare. You can reduce everybody's hours to something below 30, make them 29ers. Right. You can fire 140 employees, 60% of your company. Fire them, lose their jobs, or close up shop. In ancient Greece, those choices are hemlock, cyanide, or poisoned mushrooms. Can you describe how you came to realize these were your only three options? And have you talked to your employees about what their future is going to look like?
No, we have not talked to our employees yet. We've been trying to, research what our opportunities are. We have talked to our management staff already, and asked them to get to start getting a list of the 50 people, because the first 50 are exempt. So all of our project managers are getting their main key people a list to us, so that we can have our 50 that can still be full-time. And then we'll have to make tough decisions on, you know, the other 190 on, you know, what kind of hours we can give them. But we have not discussed it with our rank and file help yet.
Do you think anyone will say, great, I want to work for 30 hours instead of 40 or more?
No, I don't think so. Like I said in my letter, I mean, we have husband and wives that work for us. Like it says, they have, you know, we have a husband and wife that works for us. They have 3 kids. They work 45 hours a week, so they get paid 40 regular time and 5 overtime. And it's tough for them to survive on that amount of money. So cutting them back to 29 hours, that would be devastating for their family and their kids.
Thank you for that. And this next question is for you, Mr. Morrow. You have the largest and deepest waterfall in America. And you should be careful saying that in this committee because we have some Texans here. And bigger is better in Texas. That sounds like a challenge to me in many ways. But your business is seasonal, as came out with your discussion with my colleague, Mr. Burgess. And you've got 40 full-time employees now, 100 seasonal employees. If you cross these guys and the one seasonal ones, do most of your seasonal employees work for at least 40 hours per week, more than 30? They will work. Okay.
Yes, they will work full-time during, mainly between Memorial Day and Labor Day.
And so they'll be full-time employees. You will cross 50, so you have to deal with Obamacare. You have to either provide health care to these employees, all these new ones, or somehow modify your business. Is that correct?
Correct.
Can you talk to me about how the employees suffer because he's changing your employees?
The employees are going to suffer through increased cost. We have paid their premiums 100% since I've been with the company 7 years ago, and it's been part of our family of support for them. We are going to have to pass on part of that expense when we see 30, 40% increases in our premium. They will have to share in that cost going forward, which will reduce their incomes.
Gentleman's time's expired.
Thank you.
Thank you.
Yield back.
Now turn to the gentleman from New York, Mr. Tonkill, for 5 minutes.
Thank you, Mr. Chair. Our Secretary of HHS, Sebelius, has been quoted as saying many were priced out, locked out, or dropped out of health care insurance coverage in the years ensuing before the pre-Affordable Care Act days. My question is, did you as companies, or did you know counterparts that were unable to get insurance written for their companies at all? Any of you, to any of the gentlemen of the panel?
I can say that in southwestern Pennsylvania, I've had fellow manufacturing companies tell me that it's increasingly difficult to find somebody that would insure them without some huge premium increase. If you wouldn't mind, Mr. Congressman, I'd like to make a comment to what Mr. Green said. He said you guys are complaining about the fact that that you're looking for solutions. You're tired of the hits that Obamacare is taking. Well, let me give you a perspective of a businessman, if I might. I don't know whether I have that leeway, but I would happy to do that. You know, in my view, the Affordable Health Care Act was designed to get 30 million Americans that weren't insured. But one thing it doesn't do, and it hasn't done at all, is to address the real problem. That's cost. In southwestern Pennsylvania, you have basically one juggernaut, UPMC, University of Pittsburgh Medical Center. They own 60% of the doctors and about 80% of the hospitals. There's no competition. You never even address cost. One of the great drivers of cost is malpractice insurance. Not one word was written in the Affordable Care Act about tort reform.
This is not true. In Maryland in April, Maryland announced, we have 6 people announced to participate on the shop exchange. I've never had anywhere close to 6 options.
I know that people tell me all the time that the reason that doctors practice so much defensive medicine is because of malpractice insurance. I talk to doctors all the time about that fact. My cardiologist tells me that. He said that's the real reality.
I served on the board of directors, the finance committee of a $100 million health insurance.
So I'm just saying that from a perspective of a business person, I believe that if you want to get past the fact that the Affordable Health Care Act really is about putting more people in, insuring those people, fine, you've made that step, but you haven't done anything to really address the major driver of cost. And if you can get cost under control, then things probably would work better. But they're not going to happen until costs can be driven down. And you have to start addressing what are the causes of the cost to be so high. You know, and Congressman Murphy knows this, in southwestern Pennsylvania, you basically have an oligopoly of providers. You have one big provider, and he basically can charge whatever he wants. There's no competition, really. It's a real problem. And it's one problem that, because of so many special interests, you people really won't have the courage to face that problem. So that's what as a business person, I'm going to challenge you folks to come up with a way to really take on some things that are really difficult.
Right. Mr. Kelly, I think my question to you, all of you as a panel, was the affordability and accessibility of health care pre the Affordable Care Act. I was hoping to glean some information on that. And in terms of the bending of the cost curve, that is indeed part of the effort here with the Affordable Care Act, by making certain we go forward and rewarding the quality of care rather than just the number of tests or procedures performed. And Mr. Bray, I would ask if you had something to offer that to the previous statement made. I would like to hear that now, and then we could move forward.
Well, listen, I've seen a lot of cost increases long before I ever heard the term Affordable Care Act or Obamacare. I served on the board of directors of a finance committee of a hospital system, and our crushing cost was the burden of the uninsured. And I guess it's interesting to me that back then I was the evil conservative businessman because I thought everybody should pay their fair share. It wasn't fair to me to be paying for those people. And now here I am, I'm testifying for the liberal side. My views haven't changed. You know, so, you know, I have seen, I've gone for 18 years in small group, never having real choice, and now 5 insurance companies have definitely said that they are going to participate in Maryland Shop Exchange, and there's one on the fence, so that may be 6. So I may be doubling my pool of choices. We'll see if it actually happens.
Okay.
Gentleman, Jones' time has expired.
Sorry, I yield back, Mr. Chair.
Thank you. Thank you. Now turn to Mr. Long for 5 minutes.
Thank you, Mr. Chairman, and thank you all for being here today. Mr. Bray, how are your sales this year to date over last year's sales? Do you find your business has improved, stayed the same, declined in sales?
Our business has declined for the first half of this year.
It's declined?
Yes, sir. 2011 and 2012, coming out of the recession, were exceptionally strong years for us. And because we're in this Maryland, Virginia area, I think that there's been a little bit of uncertainty that has made the first half of the year less than optimal. But May finished very strong. June is going great, and so far the summer looks really good.
So, your thoughts about the Bush tax cuts expiring, whenever you said that by letting the Bush tax cuts expire, allowing the tax rates to go back to where they were will help bolster the economy, and with it, your customer base, the middle class. So that didn't work out like you thought it would.
Say that again?
Your comments about letting the Bush tax cuts expire. Letting the Bush tax cuts expire on people over $250,000.
Well, we didn't. What we did.
The vast majority, let me finish, the vast majority of small business owners simply won't be affected. Allowing the tax rates to go back to where they were will help bolster the economy, and with it your customer base, the middle class.
But instead what you did is you let payroll taxes go up on people making $40,000 a year, and in exchange for going from $250,000 to $400,000 on that tax break. I mean, that's what happened in January. My guys making $40,000 a year, $40,000 to $50,000 a year, managing one of my stores, saw their payroll taxes increase. So what we did is we took the money right out of the pockets.
We're talking apples and oranges. The Bush tax cuts were above 250,000 people is what you were talking about, which those did go back up on January 1 or January 2, if I remember right. So
I think it was over 400,000 though.
But how does letting taxes go up on people above 250 bolster the middle class? I mean, that's money that's paid to the government, to us, congressmen and senators and people here in Washington that are.
My objection at the time was that Congress appeared to be making a trade-off. The trade-off being allowing payroll taxes to go up on middle-class workers in exchange for keeping tax rates low on high-income earners.
Say that again.
I said my perception at the time, which was in January, I think is when you're talking about, my perception at the time was that Congress appeared to be making a trade amongst the members, letting the payroll tax cuts expire on middle-class workers, and in exchange, Democrats would hold down, would let tax rates, we would make the cut from go from 250, instead of the cutoff being 250, it would go to 400. At the time, that was the debate that appeared to be taking place, and that's when those comments were made.
Well, this was back in October, not January. So
I'm sorry, October.
Okay, but I'm just trying to get, I mean, you're of the opinion that the Affordable Care Act is indeed affordable, and
my opinion,
we need to work things out here in Washington. We need to work for the American people. We need to make health care more affordable for everyone. We all agree that health care needs to be reformed. Granted, I sit here representing the 7th District of Missouri, southwest corner, Missouri, Springfield, Joplin, Branson, down in the southwest corner, and there's a company at home that started out with one store back in the 60s, and now they have 53,000 employees. And when the CEO comes to me and says, I'm going to you, I'm going to Roy Blunt, U.S. Senator, I'm going to Claire McCaskill, U.S. Senator, one Republican, one Democrat, to explain to you all how devastating this Obamacare actually is. And I said, okay, I'm here to listen. He said, we provided great health care for our employees for years. They loved it. It was affordable. It was doable. Their estimate, Mr. Kelly, who found his rates going up by 46%, I'm sure they'll want to talk to you, because the way they calculated it, theirs are going to go up by 120%. They've already told all their part-time employees, I don't know how many are part-time out of this 53,000, that they will no longer cover their health insurance next year. And so 120, I forget what the dollar figure is here. It wasn't actually for this panel, but I was just curious when I trying to, hear all the good things you say and all the good things that Mr. Green, looks like he's gone, but that Mr. Green has to say about this.
But that is a tragedy. But that was going on, like I said, before I ever heard of the Affordable Care Act.
Well, not according to these folks that have 53,000 employees. And
thank you.
There's some, but anyway, I appreciate it. I don't have any time, but if I did, I'd yield it back.
Gentleman's time expired. Now we're going to Mr. Butterfield for 5 minutes.
Thank you very much, Mr. Chairman, and thank the four of you for your testimony today. I think I'm going to begin my part by asking each of you a yes or no question. That seems to work very well with Mr. Dingle when he does it. Starting with you, Mr. Bray, do you accept the goal of the Affordable Care Act to make affordable insurance available to every single American? That's a goal of the Affordable Care Act. Do you embrace that goal?
I do.
Yes. You, Mr. Kelly?
Yes.
Mr. Lizinski?
Yes.
And Mr. Maurer?
Yes.
All right. Do you believe that an employee is happier and therefore more productive when they can cover their health care costs?
Yes, sir.
Yes.
Yes.
Ours at Ruby Falls are.
All right. Finally, do you agree or disagree that a good corporate citizen would look for responsible ways to comply with the law?
Yes, sir.
Yes.
Yes, sir.
Yes, sir.
Thank you. And that's what I anticipated your testimony would be. Let me go to you, Mr. Lizinski. You have a business that is a skip and a jump from my congressional district. I'm over in Durham and surrounding area, and so thank you very much for coming today. And thank you for what you do, and I particularly took interest in the spirit of your testimony. You said that you came here today looking for solutions, and I like that, and that's the way a good businessman or woman should conduct themselves. And I also want to thank you for offering jobs to low-income people in the Wake County area. That is commendable.
We have quite a few people that actually live in Durham also. Probably about 25% of our employees are from Durham.
And you also said that some of your workforce are convicted felons.
Yes.
And that's a big deal in my world, because we have so many young men who are rehabilitated their lives and they're looking for opportunity, and you seem to be giving out that opportunity.
Yeah,
when this committee wrote the bill some years ago, and I've been on this committee now for some years, as many of my colleagues, A different group was in the leadership of this committee at the time. But when we wrote the bill, we anticipated that poor people would need insurance. And so we created what we call Medicaid expansion, which would cover employees or individuals from 0% of the federal poverty level to 133%. Many of those are working for you. And so it seems, and Mr. Gett mentioned this in her question, it seems that some of your employees would qualify for the Medicaid expansion if it existed in North Carolina. The problem is that your legislature and my legislature and your governor and my governor have chosen to decline to expand the Medicaid program in our state. And so the option that would normally be available to your low-income workers doesn't exist. And so if you have any influence with our state legislature and governor, if you would join some of us in trying to convince them to rethink this whole thing, we need full participation. Let me now ask you, are your employees currently covered with insurance?
My employees?
Yes, health insurance.
No, the majority of them are not. Once our employees get to be at the supervisor and the project manager level, yes, then we offer them health care. So we pay insurance on about, I think it's around 22 people right now.
So your minimum wage earners do not have insurance?
Correct.
Because you simply can't afford it.
I can't afford it, correct. Yeah, our margins are very small, and yes.
And we anticipated that, and we had hoped under this act that those people that you speak of, that you care about and I care about, would be able to go across the street and qualify for the Medicaid expansion, and it's not happening, and that's very very disappointing. Let me use my final minute with you, Mr. Kelly. You mentioned a minute ago that you clearly understand that this is the law of the land. I would hope that you would find some way in Pennsylvania to try to make this thing work. You haven't gotten where you are today in business without being smart and shrewd and strategic and visionary in your approach. I wish that you could find some way to make this thing work. 46% of your premiums have gone up 46% since 2010. I understand the pain. I understand the problem that poses to your company, and I would certainly hope that you would find some way to really make this thing work. You say that the average wage, and correct me if I'm wrong, I think you said the average wage was somewhere around $50,000 for your employees?
What's our average wages for our employees?
Commendable, wonderful. But that's for a single individual, and I would hope that that individual's spouse would also be gainfully employed at some other location in Pennsylvania, and he or she would be making $40,000 or $50,000 or $60,000. That's a $100,000 family. And I would hope that that family would be able to find some way to afford health insurance, because they need it. You know they need it. I know they need it. And I hope that you could get creative and help your employees get insured. Thank you for listening. I've run out of time. I yield back.
Thank you.
Gentleman's time has expired. Now turn to Ms. Elmers of North Carolina for 5 minutes.
Thank you, Mr. Chairman. Mr. Lozinski, there again, we've had numerous conversations on this issue, and I again commend you for coming forward, especially in the spirit that you're doing so, which is looking for solutions. But as we all know, many times in order to find the solutions, you also have to identify what the problems are, and you have to be willing to make changes that are necessary to do so. With that, I would like to say, and I know that you've looked at this issue. I know that this is something that's very important to you because you care very much about your employees. Again, pointing out that many of these individuals are low income, many of these individuals, 85%, are minority, and you employ those who have formerly been in prison, and now you're giving them, you and Kathy have offered them a second chance. Some of the discussion here today has focused around the idea that many of your employees, because they are low income, would therefore be able to qualify for Medicaid. And maybe some of them already are on Medicaid, that, you know, to the best of your knowledge.
Best of my knowledge, I think, yes, quite a few of them are.
And I guess my question to you is, and looking at this and the testimony that you've submitted, you've pointed out that, you know, basically what you'll have to do is cut back employees to under 30 hours, or what we're now calling the 29ers, because essentially at 29 hours, you're not obligated.
Correct.
The point being, do your employees want to be cut back hours?
Oh, no, definitely not. Yeah.
Do your employees want to work more than 40 hours?
Yes, most of our employees do work. I mean, our business is not like 9 to 5.
Right.
They go do a certain amount of jobs during the day, and believe me, when we have Saturday work, they line up for the overtime, and the majority of our employees, at least in our construction division, work more than 40, and they're always begging to work Saturday so they can pick up that extra time and a half money.
Absolutely. So the point here is that these are individuals who want to better their lives. These are individuals who want to work, earn an income. You are an employer that wants to offer these jobs. You want to grow as a business, do you not?
Yes, I do. Yes.
In the present situation, facing the implementation of the Affordable Care Act, do you see your business growing?
No, this is the first year since we've started that we haven't grown, and that was pretty much our decision because we don't know what the effects of this law is. We don't want to hire more people and have to lay them off, or hire more people and have to get them over 30. So what we've been trying to do is just been on jobs for our present customers.
Right.
We haven't been trying to expand our customer base this year. Because last year we were pretty much getting close to 300 employees, and because of what the effect this law was going to be on, that we haven't tried to grow this year until we, and hopefully we come up with a solution for us, and then we will hopefully continue to grow.
Let me ask a question about the employees that you have that have former prison records that you and Kathy have employed. In the event that you do have to lay off employees, and I'm assuming that some of them would be those individuals who are there again, getting a second chance at bettering their lives, how easy is it going to be for them to get a job out there, especially in this economy?
You know, I really don't. I don't know what the job market is around us. I'm sure it's not going to be easy. There's been a lot of them that have come to us and said, you know, nobody else would give them a chance, and you know, and they really appreciated what we did. Like I said in my letter, I had one former inmate that just celebrated his 10-year anniversary with us. He actually worked for 7 months out of a work release program out of from Raleigh, the Central Prison, and he worked as a work release program. Then he came to work for us, and he started as a laborer, and like I said, last week he celebrated his 10-year anniversary. He's now moved up to a project manager, and he makes over $50,000 a year. So.
That is wonderful. I have about 30 seconds left, so I would like to ask each and every panel member here, are you aware that the CBO has actually come forward and said that even after implementation in 10 years of the Affordable Care Act, there will still be 30 million people left uninsured? Are you aware of that, yes or no?
I'm aware of that.
You are aware?
Yes.
Mr. Kelly?
Yes.
I was not aware of that.
Yes, 30 million will still be left uninsured, and that is, again, by the nonpartisan Congressional Budget Office. So thank you, gentlemen. I yield back the remainder of my time.
Gentleman yields back. Now turn to Ms. Schakowsky for 5 minutes.
Mr. Kelly, I heard you talking about bending the cost curve. We have to do something about the cost of health care. The fact of the matter is that the increases that have been overall, I realize averages don't apply to everyone, but are at about a 50-year low right now in healthcare costs over the last year or so. And this has to do with, we just heard this today from Secretary Sebelius, but it's also CMS and Price Waterhouse that would document that. Because you're exactly right, and the Affordable Care Act took steps to address the core problem of rapidly increasing health care costs. It requires insurance companies to operate more efficiently. It subjects premiums to independent review. Some states actually have the right, their insurance commissioner, to modify rates and bring them down. And it requires that at least 80%, 80 cents on every dollar, go to health care now. can't go to CEO salaries or to marketing costs. And many enrollees in insurance policies have gotten rebates around the country equaling billions of dollars. We're beginning to now reward the quality of care rather than just the number of tests and the procedures performed. That gets at the issue too of you know, we were talking about the doctors that are doing defensive medicine. So while it's still early to say for certain, there is increasing evidence that the reforms in the ACA are on their way overall and over time to drive down costs while improving healthcare quality and health outcomes. And if you received a 46% increase over the last little while, this is not untypical. This is not about the Affordable Care Act, which hasn't gone into effect yet. And this is typical of what has been happening over the years. You have seen, I mean, sometimes I listen to these arguments and I think, well, gee, it must have been great in the insurance market before the Affordable Care Act came along. And of course, we know that that is absolutely not the case. I don't know if you wanted to comment at all on.
Well, I don't know. I must be in a different universe, Congresswoman, because we have not experienced a reduction of any kind. Yes, costs have been going up long before the Affordable Care Act. They seem to have accelerated, unfortunately. Maybe it's because insurance companies are starting to pack, you know, they're taking advantage of the opportunity, the window that's available, to just jack the prices up because they know after the so-called reforms that are going to go into effect that maybe the game will be up. However, for example, I mentioned to Congressman Murphy that there are 4 fees that go into effect next year because of the Affordable Care Act. That's going to add $48,000 to my cost without any change in coverage or anything else. That's just $48,000 in additional fees. Now, I don't know how that's bending the cost curve down. I mean, if the Affordable Care Act is going to mandate that fees be levied on insured people, and the companies that provide the insurance, I don't see that. I'm sorry, I don't see that. So you're going to have to show me where in the law that there are prescriptions that are going to drive costs down. I don't see it. In our market, it's just not going to happen. When you have 2 basic providers of health care in southwestern Pennsylvania, UPMC and Highmark, they own all the doctors and the hospitals, there's no incentive for them to cut their cost. I don't see it happening. I'm sorry.
You know, well, you know, we're all going to have to, as members of Congress, work with our constituents and with our healthcare providers to make this thing work. But, you know, getting back to sort of the theme that Mr. Green was raising before, what we're finding in this House of Representatives is rather than a willingness to sit down and talk about what are the snags in this legislation, this Affordable Care Act, this Obamacare, and figure out how to do it, it's just a continuous drumbeat of repeal, repeal, stop, get over it. We, as the United States of America, we are capable, as most other industrialized countries are, of constructing a system that is going to work for our people and for our businesses to provide health care. We could do this.
Haven't you really reaped what you've sown? And by that I mean this. You basically
expired. I need to move on. The gentlelady's time's expired. Thank you, Mr. Kelly. Mr. Griffiths from Virginia, recognized for 5 minutes.
Thank you very much, Mr. Kelly. Reap what you sow. Tell me what you were going to say.
What I was going to say was, if you look at the history of this law, well, I'm sorry you'd resent that. But the reality is that the law was passed without any support on the Republican side. So here you are, you force something down the throats of, and I feel this way as a business person, you're forcing this down my throat. I've got no say in the process. You had no say in the process. And now, because it's not going very well, because the implementation is difficult, all of a sudden, you folks are the problem. And I find that really reprehensible that is said.
And
I
Mr.
think if you would have, I think if it had been really a spirit of comedy and bipartisanship 4 years ago, perhaps what we would have would be something that would be implementable and affordable. But it doesn't turn out that way. I'm sorry.
And
Will
Mr.
the
Kelly,
gentleman yield?
I will not at this time. I only have 4 minutes left. And Mr. Kelly, would you agree with me that there's more than just snags in this bill? It's more than just a few snags.
There, absolutely, absolutely.
And I would have to say that among the things that my constituents tell me are snags, and what I've heard testimony here today is we've got the long-term care insurance part didn't work out, so they abandoned it. The catastrophic coverage that was to be the interim step cost a lot more than it was originally projected to cost. The insurance rates didn't react the way they thought they were going to do. We haven't seen any real savings there. The Secretary is having to go out and look for more money to try to get folks to enroll in the programs and to do the things that they want to do. We've got the 29ers that we've referred to several times today, which both, I mean, even if we were to change it tomorrow, the Commonwealth of Virginia has a law coming in July 1 that says that they can't have part-time workers that work longer than that because they don't want to have to pick up that cost. The Medicaid, forcing the states to do the Medicaid expansion, forcing the states to do the Medicaid expansion was ruled unconstitutional by the Supreme Court. You know, you've got problem after problem after problem, and I kind of think this is similar to Blacksburg High School in my district. The roof of the gym caved in, and the debate began, do we just build a new gym, or what about the rest of the building? And it caved in because of structural defects. And the ultimate decision was they condemned the rest of the building, and they're going to build a new Blacksburg High School. Sometimes when the construction, the initial part of putting something together, putting a building together, is so poor, you have to just say, okay, let's start over, let's go back and see what we can do to build something that does work for the American people, that does lower costs, that does expand coverage in the ways that we want to, and doesn't cost people the hours at work or jobs. Would you not agree with that, Mr. Kelly?
Absolutely.
And Mr. Lozinski?
Sure.
And Mr. Marr, as a businessman, if something is structurally flawed, don't you sometimes have to just say, okay, we're going to scrap that, bulldoze it, and start over?
In our business, sometimes we do that.
Yeah. I mean, I think everybody who's been in business very long has run into that position where they have to do that, or they have to go back and say, that didn't work. And I would submit to you all and to this committee that that's where we are on this particular plan. It was built poorly. It's not going to work as currently designed. I don't know how many patches we could put on it. I don't think we could put enough patches on it to fix it. I think we have to tear down the building and start rebuilding. And so I would ask you all about that. Have any of you all run into the 29-hour problem in your particular business where you have had to say to employees, we're only going to give you 29 hours?
Yes.
Mr. Lozinski, I think
Yes,
you
I
mentioned
have.
that earlier.
Mm-hmm.
Yeah, and I will tell you, I'm going to ask you this. I have a business in my district, and see if you all have had this problem or if you know folks who do. This business has been in existence more than 30 years. It now has 59 employees. They have 3 shifts. One of the shifts they just started a few years ago. So the businessman came to me and he said, I just left my folks. This was a couple of months ago now, and I don't know what decision he ultimately made. He says, here are my decisions. I can lay off the 3rd shift. It's marginally profitable. I worked for years to get it off the ground, but I can lay off the 3rd shift and get below the 50 employees. So I'm in the same position that Mr. Bray, he didn't use Mr. Bray's name obviously, but I can be in a position where I'm not covered by this bill. I can pay $40,000 in the fines, or I can pay $60-some thousand and cover everybody. And I've been covering, kind of like you, Mr. Lozinski. He's got a lot of folks that don't last in the business. He's in a business where some come in and stay for a couple of months and then they move on. But some stay for a while. And when they stay for a while, they get a supervisory position.
Correct.
And he's been covering all those folks for years. And he said, so my choices are, for the first time in over 30 years, don't grow my business anymore, cut back, and lay folks off, pay a fine, or pay $40,000 fine or a $60,000 increase. And he doesn't know what he's going to do, and he's wringing his hands over it. Have you all found that to be true as well?
Yes, I have, yes.
Yes. Gentleman yields back now. Turn to the gentleman from Louisiana, Mr. Scalise. 5 minutes.
Thank you, Mr. Chairman. Appreciate you having this hearing. I appreciate all of our panelists for coming and taking time away from your businesses. And because I think, as you, Mr. Kelly, pointed out at the beginning of this, it seems like the voice of the small employee and business owner was left out of this debate. back when this bill came through. In fact, this committee was here in this committee room that we had those hearings for hours and hours and combed through. I remember reading through the bill when it was this high and then it got higher. And there were so many bad provisions that we saw that could devastate small businesses, could devastate families who have good health care that they like. But there were all those lofty promises too. You know, the president's promise, if you like what you have, you can keep it. That promise has been broken to so many Americans already when the law hasn't even taken effect yet. Just businesses that are looking at this saying there's no way that they can comply, that provide good health care to their employees today. We remember the speaker at the time, Nancy Pelosi, her famous quote, "We have to pass the bill so that you can find out what's in it." Well, now you know what's in it. And as all of you have testified, the different impacts it's having. But when I go home every weekend and talk to small business owners in Southeast Louisiana, I'm hearing the same things. You know, what Mr. Lazinski, what you talk about with your small business, you know, you're competing against people that are also going to be handling this bill differently, and all of a sudden it makes changes to the way you're going to have to do business. You know, my colleague from Texas, Pete Olson, talked about the 29ers, and we've heard about them from so many of our businesses. And there are restaurants in Louisiana that everybody in this room has heard of, famous New Orleans restaurants, that have the same problem. Because the law, there's so many perverse incentives in this law that literally force you to contemplate reducing the number of your workers. You're rewarded in Obamacare if you lower the number of workers you have. You're rewarded in Obamacare if you reduce the hours to your employees. That's what y'all are facing.
Yep.
What kind of perverse incentives is that, where the federal government is encouraging you to reduce your workforce? And yet that's what's going on in this law, and we're seeing it all around the country. And so, you know, when those of us who say you need to rip up the foundation and actually go and fix the problems. Mr. Kelly, you talked about cost, and we ought to be focused on fixing the cost. This bill actually raises the cost of health care. We've seen that from so many different reports, and in fact, states that are grappling with it. In Louisiana, the estimates are over 54% increase in health care costs due to the impacts of the law. Since passage of this law in 2010, what have you seen in terms of increases in your health care costs?
Well, the cost are, premiums are 46%. The actual cost, because we pay some of the deductible, is 42%.
46% higher?
Higher.
But wait, you were promised that they would be lower. How could that be?
Well, I never thought that was
right. I think a lot of us didn't either. And
Yep.
unfortunately, you're seeing that in the real world. And that takes into account the changes you made, right? You already, you doubled the deductibles, you even changed carriers. And even with those changes, you still saw increases. Is that right?
Yeah. Congressman, the thing that's so frustrating as a business owner is that it's the amount of time now that we spend looking at not the strategic path of where the company's going to go in terms of market share and in terms of who your customers are going to be and what opportunities you're going to have. We're spending an inordinate amount of time on how are we going to manage this leviathan that's out there, this healthcare costs that are already greatly increased and appear to be on a path. You know, there is a hockey stick. It's not on global warming. The hockey stick, this is my view, it's a personal opinion, it's on the healthcare costs.
Well, you know, the lead, just take, you don't have to take our word for it, one of the lead authors of the bill in the Senate, one of the architects of the law in the Senate, Senator Baucus, called it a train wreck coming down. That was his words. He called this a train wreck, and of course, y'all are the ones sitting at the end of the track where it's coming. I want to ask you, Mr. Lazinski, because you know, you're considering those kind of options of, you know, how many employees do you lay off? Is that correct?
Well, we actually, I don't know. I think our best bet would be the 29, you know,
so
option.
You're going to have to lower the number of
right,
hours
which
that your
in
employees
turn
work
we will,
because the law is
we will,
forcing you to look at that, right?
I'm sorry. We will lose a lot of employees because they won't be able to survive on 29 hours.
What a shame.
So it'll be very hectic, and it'll be, you know, and you know, the sad part about it is, you know, our best employees are the ones that want to work the most and want to work the most hours, and those are the ones that we will lose. So
what a shame. And
I'm
almost out of time. I want to ask Mr. Moore one question. The supporters of the health care law promised that the law would lower costs for your business. Is that true for your company?
No, we've seen a lot more increases and heavier increases since this past year.
Well, thank all of you for your time and your testimony. I yield back the balance of my time.
Gentleman yields back. Now recognize gentleman from Ohio, Mr. Johnson, for 5 minutes.
Thank you, Mr. Chairman, and I too want to thank our witnesses for being here today. You know, I think oftentimes the complexities of the law and the discussions that we get into, we tend to overlook the cultural changes that's going to result long term. You know, I came from a background as a kid where I looked for an opportunity to get a job and to go to work, whether it was on the farm, later in restaurants and seasonal type work. You folks come from industries that provide that opportunity. Today we have millions of college students that are working their way through school, working hard, going to class in an effort to keep from becoming indebted to the federal government with huge student loans. So, I just want to comment before I begin asking questions that this is going to have far-reaching implications far beyond just the benign discussion of health care. It's going to have societal and cultural changes as industries like yours have to pare back and pull back and are unable to grow and hire and laying off workers. It's not going to be good. Mr. Morrow, you testified that let me go back. My colleague pointed out just a minute ago, one of the big promises of the health care law was to, if you like your current health insurance, you can keep it. Do you believe that your employees like and enjoy the health care coverage that you've provided to them up until now?
Yes, I do. They helped us architect that plan. For instance, prescription drug coverage was extremely important to them, so we spent more money in that area for them, and we also spent a lot of money on well health care for preventative health care. We have health fairs. In fact, we had an employee that we found prostate cancer in its early stages through a simple health fair. It saved his life. He's on Medicare. He doesn't go to the doctor, as he said, and I caught this. So, yeah, we constructed it with their input for the best coverage as possible.
Do you think you're going to be able to sustain that? Are you going to be able to provide that same level of health care that was promised to all Americans by the President? Do you think you're going to be able to do that?
I don't think we are, because the costs are going to become prohibitive for us to do it through our family at Ruby Falls as private health care coverage.
Mr. Lozinski, Mr. Kelly, either of you have a comment on that? Are you going to be able to provide the same health care coverage in the future that you've provided in the past?
Based on where we're headed, I don't know how we can. You know, we really value. I mean, we're becoming an ESOP. My employees already own 49% of my company. They're going to own 100%. I mean, nobody can value their employees more than somebody who says, I'm going to actually give you the company. They're not paying for that. Under the ESOP rules, they are going to have ownership of the company. My concern for them is when they have to sit down and manage the company and have to decide those really tough questions. By the way, we have a health committee that looks at these increases that we get every year. They decide what they're going to do to keep us competitive. It's not me.
Yeah.
And so, honestly, I don't know what they're going to be able to look at in 4 years and say, what are the choices that we have?
Sure.
Do they get rid of their fellow employees?
Yeah. Let me move on quickly. You know, we just saw a report a couple of weeks ago. The state of Ohio, for example, the Ohio Department of Insurance says we're going to see an 88% increase in premiums, a staggering increase for college students, and a lot of that is because we've seen a change in the risk pool composition. The younger are going to be paying higher premiums who are healthy to subsidize the more senior folks who may be unhealthy. In your situations with your employees, do you think young people are going to pay these higher insurance premiums, or are most of them going to opt for the penalty? Any of you, Mr. Morrow?
I would say they're going to opt for the penalty.
Okay, Mr. Kelly?
I believe that's what they'll do.
Mr. Lindsay?
Yes, I would think so.
Okay. Mr. Chairman, I've exceeded my time, and I yield back. Thank you, gentlemen.
Thank you. Now recognize the gentleman from Georgia, Dr. Gingrey, for 5 minutes.
Mr. Chairman, thank you. I want to first go to Mr. Lozinski because, Mr. Lozinski, as I heard your testimony in response to some of the other questions, and you mentioned that there are a lot of former felons that you've been good enough to hire in your business in North Carolina. And you were talking with Mr. Butterfield earlier about that. There was a discussion about the Medicaid program and Medicaid expansion. But just a few minutes ago, you said that if you have to cut to 29 hours a week to avoid the expense of health care, that a lot of these people won't be able to make it. That they'll have to find another job,
Correct.
maybe to make do. And you know, I couldn't help but think, in your unique situation, some of these people that you talked about, you would be forcing them back into the only other skill set that they know, so as to support themselves and their families. And wouldn't that be a tragedy when you've gone to all of the tremendous Good Samaritan work to give them the opportunity to set their lives straight?
Well, I sure hope not. And all
Well,
of
I
my
hope not.
employees
I
are
hope
really
not,
good,
too.
really good. So
I hope not too. But now let me go back to that issue of Medicaid, because I think this needs to be clarified for everybody, and they need to understand. Why do you think in drafting this bill that they wanted to, the Democratic majority wanted to expand Medicaid coverage to 33% above the poverty level? We say 133%, but the poverty level is 100%.
Right.
To expand it to 33%, because quite simply, if you had all of those people in that window between 33%, between 0 and 400% of the federal poverty level, you think about the cost of the subsidies that the federal government, this federal government would be paying, especially those who were at 33% above the federal poverty level. They would probably be paying something like 75–80% of the premiums. So to put it on the backs of the states where there's this matching program, this FMAP, granted, there's a couple of years where the federal government pays for all of it, then there's another year or two where the federal government pays for 90% of it, but it's a loss leader, just like a used car lot or a grocery store. Come on in, get something, and first thing you know, it's not there anymore.
Right.
And I'll guarantee you in 4 or 5 years, and that's what these governors are looking at, they know that once that expansion occurs in 4 or 5 years, that FMAP is going to go back to 50-50, 60-40, 55-45, and they're going to have no money for anything but Medicaid, no money for public safety, no money for public schools, an absolute train wreck, as Chairman Balkus said. So that is a scheme to keep those people out of the exchange where it would be just federal dollars supplementing their health insurance premium. So I just want to bring that out. Real quickly, I'd like to thank all the witnesses. It's sobering to hear the trouble and uncertainty that your businesses face. I have, unfortunately, heard much of the same from small businesses back in my home state of Georgia, if you can't tell by the accent. I have heard from the overbearing compliance burden that businesses must endure to ensure that they are not breaking the law. Instead of investing money in their workforce or expansion, they are forced to hire consultants and law experts. This is no way to create new jobs and incubate small business growth. I spoke to another constituent, an owner of a welding company that pays high wages and benefits to its employees, who has decided to hire subcontractors or automated equipment instead of hiring new workers due to the fact that he is just under the 50 employee threshold. Based on a U.S. Chamber of Commerce poll, 72% of small business executives would have a harder time hiring Mr. Chairman, it is clear. It's clear that the President's health care law is placing an undue burden on our small businesses. And quickly, in these last few seconds, to all of the witnesses, 3 of you operate businesses where in the future you will be faced with the choice of providing coverage or paying a penalty. Have any of you looked at the feasibility of this and which is cheaper? Can we start with Mr. Bray and just go right down real quickly?
As we expand, I intend to continue attempting to provide coverage. I have not looked into which would be cheaper.
Mr. Kelly.
That doesn't really apply to me because we're
Mr. Lozinski?
As from what I understand as of now, the fine is cheaper. I did read a couple days ago where there might be just a basic preventive plan that kind of skirts the law, but will satisfy the law, and that comes in at around $50 a month for an employee. So that's something that I just found out about a couple days ago that I'll look more into, but I didn't have, I didn't look into it before.
Mr. Morrow?
It would be cheaper for us to pay the penalty, but it's not part of our culture with our family.
Well, I understand that, and I look, I'm beyond my time. I'm sorry, Mr. Chairman, I yield back.
Thank you. I thank the gentleman. I also thank this panel. It's very helpful to have the information from all of you. We deeply appreciate it. We're trying to get our hands and minds around this issue, and the testimony provided today has been very helpful to us. So thank you so much. This first panel is dismissed, and while the second panel is taking their seats, I will introduce them all so we can be moving forward here. So let me just describe our second panel here. Our first witness is going to be Mr. Daly. Bill Daly is the Legislative and Policy Director for the Main Street Alliance. The Main Street Alliance is a national network of state and locally based small business coalitions. Our second witness is Katie Mahoney. She is the Executive Director of the Health Policy at the United States Chamber of Commerce. She has more than 13 years of healthcare experience in hospital and health plan operations, as well as healthcare policy. She is responsible for the healthcare regulation portion of the healthcare policy portfolio. And our third witness is Michelle Neblett. She is the Director of Labor and Workforce Policy for the National Restaurant Association. She's responsible for labor and workforce issues, including healthcare. Our fourth witness is Neil Trotwine. He is the Vice President and Employee Benefits Policy Counsel for the National Retail Federation. In this role, he serves as NRF's lead advocate and strategist on healthcare policy and legislation, and manages NRF's exclusive Health and Employee Benefits Committee. I thank all the members for being here. I'll now swear in the witnesses. So as you're aware, the committee is holding an investigative hearing. When doing so, has a practice of taking testimony under oath. Do you have any objections to taking testimony under oath? All of the witnesses say they have no objections. The chair then advises you that under the rules of the House and the rules of the committee, you are entitled to be advised by counsel. Do any of you desire to be advised by counsel during your testimony today? And all of the witnesses decline. In that case, if you'd all please rise and raise your right hand, I'll swear you in. Do you swear the testimony you're about to give is the truth, the whole truth, and nothing but the truth? Thank you. All of the witnesses responded that they do. Well, you are now under oath and subject to the penalties set forth in Title 18, Section 1001 of the United States Code. You may now each give a 5-minute summary of your written statement. We'll start with Mr. Daly. You're recognized for 5 minutes.
Thank you very much for the opportunity. Thank you, Mr. Chairman, Ranking Member DeGette. I am Bill Daly. I'm work for the Main Street Alliance. We represent about 12,000 small business owners with organizations in a dozen states and at-large members throughout the country. Our members are very supportive of the passage of the Affordable Care Act because of the market that they've confronted over the last decade at least for small businesses. It's been a disaster. You've already heard testimony about the price that they've had to pay. The biggest challenge we face is affordability, and I must say that at least in some surveys now we're beginning to see some hope. The actual filings that are being made under the Affordable Care Act that have been surveyed, there are 9 states where there are actual filings of rates are coming in under CBO estimates. And as you heard others state earlier today, there is evidence that the health care cost trend is slowing, so we can be hopeful. There are reasons for us to be hopeful about the market too, because it simplifies paperwork. It gets rid of a lot of the problems we've encountered trying to get quality care and benefits. Many of our businesses have not purchased health care because they didn't think it was worth it, given the exclusions, the rescissions, the pre-X's, and the low benefits that were available. Our members are hopeful that they will benefit from the Affordable Care Act and look forward to its implementation. On the matter of the question of employer mandates, again, let's make it clear, under 50 employees, those mandates do not apply. And over 50, some 94% of the companies are already qualified. So you're talking about a very narrow sector of the economy when you talk about this issue. On the matter of the 30 hours, I must also point out that only approximately 1% of the entire workforce in the United States falls into the category that's being discussed. So as you look at these problems, please try to keep them in perspective. I also want to just mention the question of paperwork and simplicity. One of the issues our members raise constantly confronting bureaucracies is that they have the daunting task filling out the forms. They look forward to the simplicity of qualifying for insurance through exchanges and the new simplified online processes. They also have found, and our members have come here to testify, that qualification for the credits under the Affordable Care Act, which many of them are getting, took very little time and was greatly beneficial to them. You've all heard a lot of these other issues already today. I just want to mention one other thing, and it's the functionality of the markets at the state level. You heard testimony about Medicaid. In those states where Medicaid is not being implemented, indirect costs will continue to fall back into the market, and risk will continue to fall back into the market, creating affordability difficulties. In a number of states that are implementing their own exchanges, there are still some questions about competition and how well it will actually function, and we do hope that you will continue to monitor that. But overall, we think the Act is poised to be a success for small businesses. We look forward to its implementation, and we appreciate the opportunity to come and present some remarks to that effect.
Thank you, Ms. Staley. Ms. Mahoney, recognized for 5 minutes.
Thank you, Mr. Chairman and Ranking Member, and other members of the subcommittee for the opportunity to participate in today's hearing. We appreciate the focus on the challenges facing America's business under the health reform law and believe we must all do what we can to help employers and their employees deal with the challenges of implementation. I'm Katie Mahoney, Executive Director of Health Policy at the U.S. Chamber of Commerce. With our diverse membership, we're particularly cognizant of the problems facing small businesses as well as large corporations. While the Chamber opposed the health reform law during the legislative debate, we are moving forward to help our member companies understand and comply with the law. To that end, we continue to work with the regulators to mitigate the burdens and challenges of implementation and with members of Congress to provide relief to business. Our vision of reform continues to be one where Americans can access affordable health care coverage, receive innovative and high-quality care, and realize better health. Tomorrow, the Chamber will release a report with recommendations to improve access to affordable coverage and drive greater health care value. While the report outlines ways to improve the system, today's hearing focuses on the system created by the health reform law, and that is where I will focus my comments. As the first panel outlined, despite the goal of the employer mandate, the health reform law is eroding the employer-sponsored system and forcing employers to consider significantly changing their workforce, not because these changes make sense for their customers or their employees, but because they are necessary to keep their doors open. In many cases, employers are not hiring new employees, they're canceling expansion plans, reducing employee hours, and dropping the affordable health care coverage that they had previously provided for their employees. Beyond the statistics, the real-life conversations we have with businesses are perhaps the most remarkable. What is most shocking during these opportunities is the complete confusion as to what the law will require. While we're eager to explain recent regulatory developments, we find ourselves still outlining the basics of the law, such as what constitutes an applicable large employer and the difference between a full-time equivalent and a full-time employee. So what are we to do? We're working hard to educate our members, regulators, members of Congress, and the public. First, for our members, we've created a new website, Health Reform Law 101, which has a variety of interactive resources including a coverage or penalty chart, an employer mandate penalty calculator, an interactive timeline, and an FAQ page. We are getting great feedback on these resources. Secondly, we've been working with the regulators, submitting comments and meeting with the administration to highlight problems with the regulations promulgated to implement the law. We've filed 62 comments to date to mitigate implementation burdens at every opportunity. For example, one key point that we're focused on now is encouraging the Treasury to use its discretion to not tax the tax, but to exclude the portion of the premiums collected to pay for the health insurance provider's fee from gross income for reporting purposes. This important and feasible regulatory approach would save small businesses unnecessary premium increases of between $45 and $70 billion over 10 years. Third, we've been educating members of the House and Senate and pushing for relief with regard to several critical provisions. First and foremost, our focus is on the employer mandate and how it will hurt employees as well as employers. Unfortunately, and perhaps ironically, because of the mandate, not only are employees not receiving health care coverage, they're now losing full-time wages. To rectify this, we continue to push for changes and believe that restoring the definition of full-time employment to the traditional 40 hours per week is a critical step in the right direction. Fourth, our efforts to educate the public will be even more important in the coming months as the administration begins its PR campaign. We need to have an honest discussion about what the law does and does not do. Selling the law to the public instead of educating the public about the law is going to lead to further confusion and frustration. Beyond the employer mandate, the list of problematic provisions is long, and several constantly rank as the most dire for business. The health insurance tax, the essential health benefit package requirements, the limits on out-of-pocket maximums and deductibles will all increase premiums and reduce flexibility, continuing to contribute to the one-size-fits-all vision of healthcare under the PPACA. It's like forcing all car manufacturers to make only cars with leather seats, DVD players, GPS systems, sunroof, and seat warmers, where many people can only afford a more modest car at a lower price. In conclusion, regardless of our opinions of the law, it is being implemented. It is critical that everyone, businesses, regulators, members of Congress, and the public, do what we can to mitigate the harm on Americans, our economy, and innovation. We must engage in an honest discussion, not a sales pitch, to inform individuals about the law and to take every opportunity to ease burdens, administrative burdens, preserve flexibility, and reduce premium increases. Finally, we urge business to continue to innovate and work within the confines of the law to develop and offer coverage options that employees value. We urge the regulators to adopt a compliance assistance approach as opposed to strict enforcement. We urge our elected representatives to pass legislation that would restore common business standards for the definition of full-time employee, and we urge the public to be inquisitive and cautious as they assess the information available to understand the law. Thank you.
Thank you, Ms. Mahoney. Ms. Nesbitt, you're recognized for 5 minutes. Neblett, excuse me, Neblett.
Thank you. Chairman Murphy, Ranking Member DeGette, members of the Subcommittee of Oversight and Investigations of the House Energy and Commerce Committee, thank you for the opportunity to testify before you today regarding the challenges restaurant and food service operators are facing in implementing the 2010 healthcare law. My name is Michelle Neblett. I'm the Director of Labor and Workforce Policy for the National Restaurant Association. We are the leading trade association for the restaurant and food service industry, which is comprised of 980,000 restaurant and food service outlets, employing 13.1 million people who serve 130 million guests daily. Our industry employs about 10% of the U.S. workforce, and restaurants are employers of choice for many looking for flexible work schedules. As a result, we employ a high proportion of part-time and seasonal workers. Much of our workforce could also be considered young invincibles, as 43% of the employees are under age 26. The National Restaurant Association is active in helping our operators understand the requirements of the healthcare law. We have conducted numerous webinars and countless educational sessions in partnership with our state restaurant associations and as part of our annual trade shows. We have detailed written materials, and through our Healthcare Knowledge Center website, we are trying to provide a one-stop place for an operator can go to understand the law's requirements. In my role, I have traveled around the country conducting these educational sessions and answering operators' questions as they work through how to comply with the law. What I have learned is that this is one of the most challenging requirements placed on the restaurant and food service industry that any can recall, and it is clear that the law cannot stand as it is today. While the Restaurant Association has worked since enactment to constructively shape the regulations, legislative action is needed as there are limits to what can be done through the regulatory process. With a little more than 3 months until open enrollment begins October 1st in the exchanges, and employee notification about those exchanges by employers must go out as well, the time for restaurant and food service operators to comply is now. The overarching challenge our members face with this law is to first understand its complexity and interwoven requirements. By far, the definition of full-time employee under the law poses the greatest challenge for my industry. The statute defines full-time as an average of 30 hours a week in any given month. This is not based on existing law or traditional business practices. Certainly, restaurant and food service operators, like many businesses, have traditionally used a 40-hour work week. One of the attractive benefits of working in our industry is the flexibility to adjust one's hours to suit their own needs. However, for the first time under the law, the federal government has drawn a bright line as to who is part-time and who is full-time. As a result, employers with variable hour workforces and flexible scheduling must be deliberate about scheduling hours because there is now a greater financial impact with potential liability for employer penalties if employees who do work full-time hours are not offered coverage. If the definition is not changed to align better with workforce patterns, there is concern that the flexibility so many employees value in our industry will no longer be widely available, and structural changes to our labor markets could occur. The applicable large employer determination is also too complex and stifles small employers' ability to manage their workforces, plan to expand their businesses, and prepare to offer coverage. The automatic enrollment provision is a concern that could cause financial hardship for some employees and greater confusion as well, without increasing access to coverage. Finally, these challenges clearly demonstrate a need for broader transition relief without threat of penalty or subsidy recapture for good faith compliance by both employers and employees. We believe it is appropriate to provide time for employers to make plan and system changes and for employees to understand their options under the law. In conclusion, thank you again for the opportunity to testify before you today regarding the challenges restaurant and food service operators face as they implement the law. The National Restaurant Association is dedicated to providing restaurant and food service operators with the information they need to face these challenges and to make the best possible decisions they can for their employees and their businesses. Thank you.
Thank you, Shields. Mr. Trautwein, you're recognized for 5 minutes.
Thank you, Chairman Murphy, Ranking Member DeGette, and honored members of the committee. I appreciate the opportunity to appear before you today to discuss the challenges of ACA implementation and how we in the business community, particularly retailers, are reacting to those challenges. My name is Neil Trautwein, and I'm a Vice President with the National Retail Federation. NRF is the voice of the retail industry worldwide, everybody from the very largest to the very smallest and everybody in between. Our membership also includes chain restaurants and online retailers. We figure our members support everybody from stores to supply chain, 1 in 4 jobs in the American economy today. So it's particularly important that the transition moves smoothly. We continue to have concerns about the ACA, but we're also working very hard to help educate our members on what's coming, when, where, and how. We've worked hard and productively with the administration to help address and smooth wherever possible particular provisions in ACA implementation. Yet we still remain worried by fast approaching deadlines for implementation. Our nation can't afford to have the ACA stumble out of the gate as it makes its debut. We've been closely engaged in the regulatory process ever since the ACA was signed into law, probably before the ink dried on it. We've met numerous times with regulators, and we've submitted numerous written comments. For retail, our part-time and variable hour employees are a particular challenge for us. Some may become full-time and move on to long-term careers in retail. Others value the great flexibility that part-time work provides. Many of the most useful regulatory approaches that have been developed to deal with these problems, such as the look-back stability period, in turn breed additional complexity and are a challenge to implement. One very significant challenge is the 30-hour rule for full-time coverage. As my colleagues have said, most of us have long assumed that 40 hours, consistent with federal overtime rules, is a normal full-time work week. A 30-hour definition forces retail employers to manage to a new standard. The requirement to provide an equal period of stable coverage to the look-back adds to the stakes, complexity, and anxiety employers have over this provision. We'll be forced to fine-tune our workforce and adjust the balance between full-time and part-time in order to meet the new realities. This is time, effort, and money spent on compliance rather than on retail or chain restaurant sales. For variable hour employees who don't reach that standard, as my colleagues have said, it means less money in their pockets. We strongly support the efforts that have been commented on to redefine full-time work at 40 hours as is traditional. We respectfully ask that this and other steps to address the shortcomings of the ACA be addressed before it becomes fully effective. Later on may be too late to really make a difference in the amount of change coming. We respectfully don't agree with those who either argue full implementation or full repeal are the only options. We think we need to move ahead on specific changes. We have responsibilities in the here and now, and our members have responsibilities to their employees, their stores, shareholders, and communities. We'll bend every effort we can to mitigate the impact of the ACA on the retail and chain restaurant industries. We also urge Congress to consider an outright delay in the provisions in order to allow businesses to spool up and create the systems they will need to manage these requirements. Alternatively, Congress could consider a soft rollout and more compliance-oriented in order to help them move through this. Again, I greatly appreciate the opportunity to appear before you today. We urge you to be wary of the pace of ACA implementation. This could have the effect of freezing employers and forcing them away from providing coverage. At a minimum, it's going to pressure our ability to continue to provide coverage. We hope to work with you to mitigate those harmful effects. Thank you.
Thank you. I thank all the panelists. I'll start off by asking questions for 5 minutes. Just for the record, Mr. Daly, I appreciate your testimony. You made reference to an article that actually a number of members have been talking about, and that was something from Health Affairs, I think May of this year, which was doing some analysis of healthcare costs and them declining or flattening out. I call attention to a couple of other articles. Kaiser Family Foundation did a study, and it said that some of the leveling off of healthcare costs actually began in 2002. New England Journal of Medicine article from last summer said that the leveling off has been going on since 2005. And the Health Affairs article made references to a couple parts. One was the job loss and economy. That's a fraction of the leveling off, am I correct? That's a fraction, but not the whole explanation for leveling off of healthcare costs and some declines.
Actually, I'm uncertain I can be heard, but actually the article pointed to the recession as a considerable contributor to leveling off. However, not only that article, but another, both found that there were structural changes in the healthcare system itself.
Right, and I believe
this to be long-term, and that would in fact reduce the growth of costs.
Yes, I just want to go on the record as saying that those what they referred to in that articles in Health Affairs was the out-of-pocket costs for employees have gone up, and that is that it has shifted from the employers to the employees, And that's been a significant part of the impact as well as I think the article also referenced a reduction in the rate of new technology. I just wanted to make sure we have that fact on the record for members to note that these articles are not referencing the Affordable Care Act as making things more affordable. They're saying the structural things you said. No, we don't have big technologies introduced. The economy has been down, and employers are basically shifting benefit cost to employees, so employees are seeking the health less there. But let me go on to a couple of things for Ms. Mahoney, Ms. Neblett, and Ms. Troutwine. What do you hear from business owners about the burden of complying with the health care law in terms of the time requirements and their costs of just compliance? Ms. Mahoney, what do you hear there?
You know, I think some are savvy and they say, wow, I'm really overwhelmed with what all I'm going to have to do to comply. I'm talking to my broker. I've been looking at what the reporting requirements are going to be. It's a lot. Others are, I think, just really shell-shocked. I mean, it's really remarkable when we travel the country, I know my colleagues do as well, to speak with small businesses that, you know, really have no understanding of the kind of basic function of the law and what all it will require, and sort of their brilliant ideas about how to circumvent it, whether it's letting their spouse or their child, you know, take a bigger portion of ownership. And, you know, we all appreciate that there are common law or laws of common control and aggregation that are going to be, you know, very confusing to kind of navigate with regard to those possible solutions. So, you know, I think it depends on what segment of the employer community you're talking about, what segment of the country. Not only just size, but industry.
Well, let me move that. Ms. Neblett, what are you hearing?
Yeah, I think our operators are small businesses, mid-sized businesses, large businesses, and so we have a range of operators that we're talking to, and some have HR departments and have the benefit of benefit consultants and attorneys and others to help them. We're talking to a lot of those smaller operators, those right on the bubble of 50 FTEs when we go out and speak a lot, those just over that threshold. And the complexity is one to get over and then dive into the details, because the details really do matter in this.
Ms. Troutwine, I only have a minute left.
Share the same experience. I've been very surprised by how much of an all-hands effort it is for larger companies, everybody from HR, who you would expect, but also finance, legal, information technology, and on down the line. But when you go down that chain, it gets to be a lot more frustration, and these are the same people we're trying to help educate.
So let me ask this. My assumption is you're going around the country trying to explain the health care bill. None of you are undermining the health care bill and saying, here's how you get away from it. Am I correct? All the panelists saying this. So you're out actually teaching the people how to comply with the bill. Is that correct?
That's correct.
Now, given that, do they have enough information on how to comply, and is it working?
No.
Quickly.
No, and I think my biggest concern is that the effort to educate will turn more into a campaign style of selling. I know this is a very controversial issue, but or law, but to sell, for example, preventive services as free care, I think is.
So is it an issue that it just has to do with how this is sold or how this is pitched, or fundamental in the law itself, there are flaws that they're difficult for them to comply with? Real quick.
I think the Achilles heel of the law is its complexity, and we heard the differences on applicable size and number of hours on the first panel. It's a tough law to understand.
Thank you.
I think it's complex, but there are also some very specific challenges, especially for my industry and industries like mine, that it makes it particularly difficult.
We appreciate getting the details from you on that. I yield now to Ms. DeGette for 5 minutes.
Thank you, Mr. Chairman. I want to start out by thanking the three people over here, Ms. Mahoney, Ms. Neblett, and Mr. Troutwine, because even though all three of your organizations oppose this legislation, you are all working assiduously to try to implement it in an appropriate way for your members, and I really appreciate that. The other thing I would wish is that my colleagues on the other side of the aisle, I've been saying this for a long time, let's put bygones be bygones. This bill is here now. We've had 37 votes to repeal it, and it's not going away. So what I think we should do, and I know the chairman agrees with me on this, I think we should be really working on ways to make it work better for small businesses and for everybody, because the ultimate goal is to give high quality health insurance to all Americans. And we heard this last panel of small business people. Some of them I know don't agree with me. They all said they want to offer insurance to their employees. And I would think that would be true of all of your members. They all want to be able to do that. Mr. Daly, is that correct? Yes or no?
Ours, absolutely.
Ms.
And
Mahoney?
One of the things.
Yeah, I'm sorry, I don't have much time. Ms. Mahoney?
Yes.
Ms. Nebbit?
Yes.
And Mr. Troutwine?
Yes.
And you know, all of you are bringing suggestions to the table that I think we need to look at, because I don't, you know, we're still trying to revise Medicare, and it was passed in 1964. So definitely we should be working on that. And like your 40-hour suggestion that you're making and other suggestions, I think we should sit down and talk about that instead of sitting here and quoting things that were said when the bill was passed on both sides of the aisle. And Ms. Mahoney, you're nodding your head, so I assume you would agree with that.
I would agree. I think one point I would make is the need for flexibility.
Yeah, and you know, this kind of goes to the other point you made, which I like, which is, and this goes on both sides of the coin too, is we should be educating people, not trying to sell this. And that's true on, you know, we shouldn't be having commercials saying this is, you know, great for everybody and it's free, and we shouldn't be having commercials saying this is terrible and don't do it. And I agree with that. And the other thing I agree with that all four of you said is, as I go in my district and around Colorado, there is a lot of confusion about what the Affordable Care Act is. So I welcome your, I got the names of your websites, and I welcome, you know, your participation and your partnership in trying to explain to people, small businesses in particular, what this does. And there is so much misinformation out there. I do want to ask a couple of questions. Mr. Daly, I think I already asked this, but you know, your sense would be that small businesses really do want to offer their employees insurance. Is that correct?
I think that's surveyed and universal almost. They want to.
They want to, but yet over the last number of years, small businesses have been really the hardest hit by great increases in insurance prices, and also less ability to get affordable plans for their employees. Is that right?
Absolutely. The markets have been adversely selected. There's tremendous cost, and it's very difficult to.
And part of what happened for small employers, so for small employers, this was in your testimony, they had to pay 18% more than large insurers for complete coverage. Is that right?
That is correct. Yeah.
And a lot of those plans, people were thrown out if they had pre-existing conditions, or if they hit the caps, or issues like that. Isn't that correct?
That's why many of them don't buy, because the quality of the insurance isn't very good.
You know, I had mentioned before, I did this little town hall meeting with some small businesses in Denver last Friday, and there was a small company, and the woman said, you know, my husband and I own this company, and we have a child with severe handicaps. She said, it doesn't pay for my employees to go into my insurance plan because it would cost so much for them. I'm sure that happens a lot with small businesses. Is that right?
We just had a personnel person had a stroke.
Yeah.
Everybody's premium went up $1,000.
Everybody's premium went up. Now, one last thing, and I hope all of you know this. Several people mentioned we don't want a one-size-fits-all, and I agree with that. But under the Affordable Care Act, just within the exchanges, we have several different levels of plan, and we also have catastrophic plans for younger workers that would help with Ms. Neblet's employees. So, in fact, we have a variety of options. It's not that everybody has to have one plan. Is that right?
That's correct.
But what we do is we make it so there's a minimum level of coverage, so if somebody gets sick, they actually have insurance that they can use. Is that right?
I think you need to be clear that there are standards pegged to employer responsibility, that there are certain levels of offering that need to be made.
Right.
There are different offerings in the exchanges that are available.
Yeah. Thank you very much. And thanks again to all of you for coming. I look forward to working with you as we sort this all out.
Thank you. I now recognize gentleman from Texas, Mr. Olson, for 5 minutes.
I thank the chair, and welcome to our second panel. A special thanks to you, Ms. Mahoney, for the help the local chambers have done back home in Texas 22. They've been giving me access to your member organizations, and I go there and listen to them. I appreciate that. and I get the challenges they're facing in Texas 22. And many of these businesses are restaurants. So I need to thank you, Ms. Neblett, for all the hard work you've done at the National Restaurant Association. As you know, Texans love to eat out. And when I want to get a pulse on the issue, I go get some barbecue, some Tex-Mex, go to a burger joint, a steakhouse, a Chinese food place, an Indian food place, and get a full belly and a full mind. So thank you, thank you, thank you. My questions will focus on Obama's prosperity, the Obamacare's prosperity-threatening definition of 30 hours of work as full-time work for the week. Excuse me for a minute here. Almost a year ago, I toured a steakhouse in Pearland, Texas. It was heartbreaking. Owners painfully telling their employees in the future they'd be limited to 30 hours, less than 30 hours, 29 hours, the 29ers per week. Many of these kids, and they were kids, were working part-time, full-time, 40 hours a week, and going to school. There were single moms raising a son or a daughter who did not have the flexibility to find another job. They need to have the job they had for 40 or more hours. And my questions are for all four of y'all. First with you, Ms. Nesbitt. Since this train wreck is coming, and it sounds like you really have no information to advise your membership, if you do have that information, please tell me what you're advising. If not, what do we need to give you so your members can make informed decisions about the future?
Thank you. We help explain and lay out the law's requirements for our members, explain the regulations. And there were, as Neil mentioned, the look-back stability period is very helpful, although still complex to implement for those variable hour and seasonal employees when a large employer is offering coverage. But I think we need a one-stop place for information about the law. I think that would be very helpful from the federal government's perspective. And I think we really need to take a close look at this definition because it is having potential impacts on the employees in terms of hours and wages.
Mr. Trotwine?
We are engaging in similar efforts, talking about different options. If you look at the law, there's a neon sign saying that it's cheaper to pay a penalty than to provide coverage if you're in that applicable large employer size. But there are other options, and last panel talked about some of the newer things and strategies of satisfying the A penalty but not the B penalty. And all this is contrary and foreign to the process of running a retail or chain restaurant store. And that's part of the problem and part of the frustration in the employer community.
Mr. Daly.
I need to point out that the Towers Watson, which is a huge HR firm across the river in Virginia, did a survey of employers about the 30 hours and found that almost none of them plan to change the way they treat their employees. There are reasons for that. It's difficult administratively to mess around with more employees in order to bring your workforce down under that 30-hour lid. It offends your employees if you make them 29 rather than when they were 35. And again, keep in mind, as I said in my testimony, the category that this affects is around 1% of the entire U.S. workforce.
Yes, sir. One final comment. I got a little bit of time here. I mean, some of my colleagues on the other side of the aisle have been saying we're just after this bill because it's politics. It's not politics. This 30-hour provision needs to be fixed. It's a big problem, your businesses, and we're trying to fix it. That's why I have this hearing. And one other thing, we talked about, Mr. Trotwine, you brought up the so-called large businesses. Every business I've talked to back home has more than 50 employees. Every single one who provides health care now likes that. They get better employees. They keep them longer. They want to give them health care. but they have to compete. And one of their competitors drops out, goes to exchanges, they will do it. Everyone has told me that. So their health care they won't get to keep their health care. That was a false promise. I yield back.
Thank you. Mr. Long, recognized for 5 minutes.
Thank you, Mr. Chairman, and thank you to the panel taking your time to be here today. I know our first panel ran over a little longer than what we all anticipated, but thank you all for being patient and being here. And as we have heard here today, the impact of this legislation known as the Affordable Care Act will have a major and often harmful impact on businesses, small and large, across our nation. One particular company based out of my district, which is a Fortune 500 company. This is a Fortune 500 company that started with one little store, one dream in a guy's mind that he could start a business back in the 1960s, so he opened his first store. Fortune 500 company now, they employ 56,000 employees in retail stores across the United States. And they have a desire to continue offering affordable health care plans like they've been offering for all these years to their employees, to their workforce. Unfortunately, after making the calculations, the total impact of the law on its benefit package, the company estimates that full implementation of the Affordable Care Act will ultimately increase their annual net cost 120% or $100 million. And in their, what the CEO has told me from his lips to my ears is that it's going to be worse coverage, not as good a coverage as what they have now. It's going to cost 120% more. In order to address these dramatic new costs, the company has already announced to its part-time employees that they will no longer be offered the coverage that they currently receive. Additionally, they're exploring ways to reduce their number of full-time employees by moving them to part-time work, the 29ers as we call them today. Mr. Troutwine, I have a question for you that I'd like to direct to you. Are your member businesses similar to this company experiencing the same difficult decisions?
Short answer is
Can you pull your mic a little closer?
They vary greatly in terms of their approach, but it's at least part of the decision-making process and the balance and fine-tuning that balance between full-time and part-time. And again, they would much rather be making sales or doing other business-related activities, and they don't want to be thinking about these things.
Do you find it pretty widespread across the country with the?
I think it is.
With the companies, and I just want to say for the record, the ranking member gone. Okay. I was hoping we had at least one person on the other side to hear this, but there's this constant, and my friend Jan Schakowsky often says she hears this constant drumbeat from our side of the aisle about repeal and replace Obamacare. There are good things about Obamacare. When I ran the first time for Congress, it had just passed. It was all out there in the media. Everyone knew health care needed to be tackled, needed to be handled, needed to be changed. And there are good things about Obamacare. I'm willing to admit that. There's the allowing kids to stay on their parents' plan until they're 26, pre-existing conditions. Insurance providers used to be risk takers, and over the years they kind of became risk averters. So there's good things, and I'm willing to admit that. I would hope that the other side of the aisle, when we're trying to work through these things to help companies, help individuals to get good, affordable health care and keep the insurance that they have, would come across and admit there's some bad things about the Affordable Care Act, so we can all get together instead of we get in these meeting after meeting, hearing after hearing, where they sing the praises that everything is coming up roses on Obamacare. And it's simply not true. Now, not everything is disastrous about Obamacare. That's not true either. There are some good parts of it, but I would wish that we could work together, and I wish I had someone to talk to on the other side of the aisle, but apparently they have other things to do, bigger fish to fry, I guess I could say. But anyway, that's just kind of my statement going forward, trying to resolve these problems, because there are good and bad things about it, and we need to come to that realization instead of just coming in on one side saying everything's coming up roses and the other side saying that everything's going to heck in a handbasket. So again, I just want to thank you all for being here today, and I yield back.
Gentleman yields back. Now go to Mr. Griffith from Virginia for 5 minutes.
Thank you all very much for being here today, and I saw most of you were here listening to the testimony of the previous panel, and I do appreciate that. Ms. Neblett, one of the concerns that I have and have had with Obamacare is that a number of the restaurants in my area, particularly the fast food restaurants, indicated when I was first elected, and I was elected at the same time Mr. Long was 2 years and a piece ago now, they indicated that if, you know, if there weren't some relief from this act, that their marginal stores would have to close down. And I have noticed over the course of the last 2 and piece years that some of those restaurants have in fact closed down in my district. Now, the economy not being good and the fact that apparently our position in this country, in my district, which is a coal district, which is adverse to coal, at least according to the president, that has not helped matters any. But have you all seen a trend where some of the more marginal stores are closing down because they don't want to have to deal with Obamacare in the first place?
I think it's very hard to pinpoint exactly why, as you said, the economy has been slow, and businesses that are on the margin will always tend to go out of business. But there's no doubt that this is a complex law. It does add a lot of time in terms of trying to figure out what you need to do, and cost in terms of either the penalties or offering coverage is a big factor. And these are all things that operators are trying to figure out and deal with.
And here's, and hang on just a second. One of the concerns that I have is that I believe this bill is all built with pieces interconnecting. And so one of the difficulties I think we have in trying to work out some interesting compromises, and we've talked about the 29ers, and a lot of folks are saying, well, let's just move it back up to where it was at 40 hours a week. The problem is, I believe that, and I wasn't here when it was passed, but I believe that the reason that they lowered it down to the 29 was they thought they'd get more people actually buying in. They had the Medicaid expansion component. Then they had the component of we're going to lower that. You have to cover folks down if they're working the 30 hours, because they needed to pick up those employees between 30 and 40 hours to make the numbers work on how many people were going to be pulled into the system, how many people were going to be insured. And of course, the bigger the pool, the less expensive the insurance. So my fear is we raised that number up to 40, we solved that problem, but then we've made the overall cost of Obamacare greater because we don't have that group invested in doing that 29 to 30 group invested in being a part of the program. So I have some real concerns there, and I'm wondering if any of your members, and Ms. Mahoney, Ms. Neblett particularly, if any of your members express those concerns as well.
You know, our members haven't expressed that concern. I think for them, their focus is on
they're drowning, and they're just looking for anything they can grab onto.
How their businesses have run historically, how they can continue to keep their businesses going in a way that's best for their employees, and this is a big wrench in that piece. I don't think they're aware of kind of the economic matrix that may have gone on to the funding of it, and who gets in and who gets out. I think they're just working in.
And I think that's where it's a problem for us to come in and try to tweak it here or tweak it there, and everybody keeps saying, well, why don't y'all just try to fix it? I believe that the way it was constructed is such that if you pull out any major piece, the whole house of cards collapses. And it may have already happened with the fact that there's not the forced Medicaid expansion, which was a part of the program to make sure that everybody was going to be brought into the system one way or another. And so I have some real concerns with trying to do piecemeal fixes when you pull a piece here and it unravels something else over here. And I think if we try to fix it, we're going to spend years trying to repair what I believe is a structurally flawed from the very beginning concept that will not work. And I do appreciate that you all are just looking for solutions, because you have lots of businesses that are in trouble and that are going to have to lay off people. And I would make this one last point. I've got about 30 seconds left. While the people who are only working 29 hours may only be 1% of the workforce now, I suspect it's going to be a lot larger come this time next year, because when you have the entire Commonwealth of Virginia saying the state of Virginia says we're not going to have part-time workers at any more than 29 hours. When you look at the counties in my district that are looking at the same kind of policy, when you look at the grocery stores and the fast food places and the other businesses across the country that are looking at sending people down to 29 because of the huge cost savings if they only work 29 hours, I think you're going to see that that's a lot more than 1%, Mr. Daly, and I yield back.
Will you gentlemen yield just a second?
Well, I'm out of time. I don't have a second deal, but by unanimous consent, I'd be happy to.
We're out of time now.
Okay.
I'm sorry. So we're out of time at this point.
Are you trying, well then, that's okay. If you want to apologize, that's fine.
Okay.
Do you want to say something, Mr. Long?
Pardon?
Did you have a quick comment to make, Mr. Long?
Yeah, if I could. When I prepared my line of questioning, the ranking member was in the room, and I'm sure if you watch the video, you will see I turned around to speak to her, and she was not there. And I offer her my apology if my comments came off as being smart aleck or whatever. They did not intend to be. I didn't intend to turn and see that until you were. I turned around, I was surprised you weren't there, and I really think that we need to work together as Republicans and Democrats. And like I said in my comments, and I understand you were with your art student, which I'm going to meet mine after a while, which is a great program, and I apologize to you. I don't know if you'll accept it or not, but it's a heartfelt.
I'm always happy to accept an apology. I appreciate it. And what I'm trying to do here is the same thing you're trying to do, which is to solve a problem, and we can't do it if we're going to A, demagogue this issue or B, attacking each other.
Right, and that was my whole point, so for it to end like it did when I was trying to be helpful, I apologize.
And I'm happy that you recognize that, and I accept your apology.
Thank you, and I'll appreciate you all for tuning in to Dr. Murphy's group therapy session. Stay tuned tomorrow for more good comments on how we can work together.
Chairman, I just have one final comment, which is very brief, and aside from the fact that we do hope we can work together on all these issues. Ms. Neblett said that small businesses need one resource to go to figure out answers to the questions and to bust some of these myths. I would suggest that you put on your website healthcare.gov. That is the central website that the HHS has put up, and then we'll continue to work with you on trying to get this message out better all around the country. Thank you, Mr. Chairman.
Thank you. I thank all the panelists here today. I thank the members, and I ask unanimous consent that the written opening statements of other members be introduced in the record. So without objection, the documents will be entered in the record. And again, I want to thank all the panelists from both panels here and all the members that participated in today's hearing. I remind members they have 10 business days to submit questions for the records, and I ask that all the witnesses also agree to respond promptly to any of the questions. And with that, I adjourn this hearing. Thank you.